Way. Yes, exactly. And the travel is what's killing me. Where do you usually?
LSO, do we need to take a roll call to start with?
Yes.
Okay.
So whenever you are ready, I will start.
Okay, let's go ahead and do that, and then I want to just make a few notes on the schedule for today.
Sounds good. Senator Beitman?
Here.
Senator Brennan?
Here.
Senator Rothfuss? Senator Steinmetz?
She's excused.
Representative Allred?
Here.
Representative Andrew?
Here.
Representative Berger?
Here.
Representative Brown?
Here.
Representative Clausten?
Here.
Representative Lawley?
Here.
Representative Obermuller?
Excused.
Representative Provenza?
Here.
Co-Chairman Northrup?
Here.
Chairman Scott?
Here.
You have a quorum.
Okay, thank you. Let me just talk briefly about the agenda and the schedule, and then I'm going to ask Chairman Northrup if he has any comments he wants to make to start with. We've carried over the K-3 reading assessment and intervention from yesterday. We'll start with that, and then we'll proceed down the agenda. But if we don't get the reading assessment and intervention finished by the time we take a
Mr. Chairman,
mid-morning break,
Mr.
we,
Chairman, you carried over the recruitment and retention task force from
Force,
yesterday, agenda
yeah.
item number 8.
item number 8. Did I say the reading assessment? That's,
Yeah, Mr. Chairman, you did.
okay, that's the second item on the agenda. If we don't get that one finished by the time of the mid-morning break, we will go to the early childhood education as scheduled, because we've got a participant there that can't be with us this afternoon, and then we would come back. I'm hoping that will be unnecessary, but we'll see. Chairman Northrup, you want any?
First off, I'd like to say good morning and thank you for having a great meeting yesterday. I'd like to thank LSO for providing us with a bigger room so that we have the ability to have everybody that wanted to testify have a chance to sit down, and also for the other room to have spillover. Also thank the Highway Patrol for providing security. I know those guys stood there all the time and was glad to have them here, and just want to say thank you for making sure yesterday was a good day.
The only further thing I'll say about today is we're going to make a real effort to get done mid-afternoon, because we've got, Cheyenne is a corner of the state, and we've got members from the far corners that need to get home and get on with things. With that, from last item that was on yesterday's agenda, the update on the teacher retention and recruitment task force. State Department of Education, you're on.
All right. Good morning, Mr. Chairman. I am Laurel Ballard with the Department of Education. I'm the department's innovation officer.
Hi, Mr. Chairman and members of the committee. My name is Robin Grandpree. I am project and performance manager, but I do a lot of work with teachers.
So, Mr. Chairman, as I think we met in May and talked a little bit, we've been convening a teacher retention and recruitment task force in conjunction with all of the concerns that we have with the fact that we have teachers leaving the field and struggling with hiring enough teachers and all of those kinds of things. So we've pulled the task force together and did quite a lot of work with it that Ms. Grandpree has led. And so we're going to talk today a little bit about what we've done. We also thought about like the results that we looked at last time, and kind of going through and looking at the recommendations that have come through all of that. With that, I'm going to turn it over to Ms. Grandpree.
Thank you. So as I mentioned, I do a lot of work with teachers. I run the Teacher of the Year program as well as the Level Up Leadership program. So I was able to take my experience with both of those groups and lead the teacher retention and recruitment task force. So very honored to be a part of that. So I wanted to just walk you briefly through the process that the task force took. So in January, we put out a call for members so that we could really see who was interested in this. And we had a lot of different variety of roles that we were looking to fill. So we did select that task force and they met for the first time in February. We had 3 superintendents, a personnel director, a school counselor, 3 principals, 10 teachers, a pre-service teacher, meaning she's going through the University of Wyoming right now, 3 previous educators, a parent, 2 post-secondary representatives, as well as an industry member. So we had a pretty well-rounded group going through these things. And the first couple of things that we did was provide a literature review just so they knew what was out there nationwide around these things, so they had that information. And then as well as we presented last time, we did the educator survey so that they had both the national view as well as the local view of how to help improve teacher recruitment and retention. As you'll recall from last time, we did have 3,552 valid results in that survey. So from there, the group met. We were meeting on Saturdays in Casper. So really appreciate them giving up all their Saturday time to meet with us. They did come up with some recommendations that we're going to walk through with you today. And just as a reminder from the survey, all of these things came directly from that survey and really helped educators feel more valued and respected. And that's where these recommendations kind of stem from. These are the things that would really help them feel more valued in their work. So the first kind of section I'll walk you through is the professional development. The first recommendation there is to create a school leadership academy. Teachers in general love mentorship, and we do provide a lot of mentorship for teachers. They felt that they needed more for school leaders, that there wasn't really anything out there across the state to help those new administrators come into the school and really help them. So they really wanted to develop this school leadership academy. The second thing they talked about a lot is to create additional opportunities for teachers to earn micro-credentials. If you're unfamiliar with micro-credentials, those are competency-based professional learning opportunities. So they wanted to do more of those that count for their continuing education credit as well as recertification and help recognize more micro-credential programs. And then third kind of in this list is that provide access for teachers and school leaders to earn, again, those micro-credentials or competency-based education in behavioral intervention and prevention, with that coursework being aligned to research-based and job-embedded. With that, I'll hand it back to Laurel.
Mr. Chairman, they also, yes, Mr. Chairman.
Questions as we go through each section, or how do you want to deal with that? Because we will have some questions.
Mr. Chairman, it might be better to go through all of the recommendations just so you've seen and heard them all, and then we can come back to them. Because some you'll see, right, like she just talked about having like professional development around behavioral issues, which will meld into the piece around mental health as well. So,
Okay.
So the next piece they talked about was the importance really of focusing on the whole child, that you cannot just focus on academics, that we have to actually think about, it's hard to have students learning if they are struggling with, if we have a student that's having significant behavior issues in a classroom, it's hard for the teacher to keep teaching and with students that are disruptive and things like that. So they had several recommendations based on this. One is that they actually focused on asking for a system for identifying and screening children with mental health and emotional well-being needs even before kindergarten. So starting to look at that at the pre-K level. They talked about providing skills for pre-K programs that are designed to address the behavioral and mental emotional well-being of students. They talked about creating a sustainable scholarship program for graduate degree mental health professional candidates to help address the mental health crisis that's impacting students and staff. They were asking for scholarships for psychologists, counselors, social workers that'd be willing to work in public schools for at least 5 years. The fourth one is that they were asking that we actually talked about it. I heard it in the comments yesterday from some of the educators that we don't actually want teachers to become mental health professionals in the classroom. And so that's kind of where they were coming from in this regard for this recommendation, that they're asking for at least one mental health professional and at least one behavior specialist position, not necessarily focused on providing special education services for the elementary school. With over 250 students and at least one school psychologist and one behavior specialist position, again, not focused on special education, for every 250 students in the middle school and high school. They also want to make sure, some of our really small schools and really small districts don't always have even a full FTE through the funding model. And so they wanted to ensure that at least one full-time equivalent school psychologist and behavior specialist position for each district. They also talked about re-envisioning education, and this is very much in alignment with what we've heard with the state board, with their profile of a graduate and the governor's office RIDE initiative. They are looking and asking for restructuring of the approach to the Wyoming Accountability and Education Act. And they really were focused more on trying to pull a little bit away from YTOP. They don't believe you should take YTOP away. They believe in all of the testing and they believe in the accountability. But they would like to see more classroom, school level data in the accountability indicators that gives you a more accurate picture of what the students really look like rather than a one point in time snapshot. They also talked about reconceptualizing education to be more relevant and responsive to the challenges of the 21st century and driven by the needs of students that are dealing with what's going on in this century.
So our last section here goes directly back to the highest ranked priority in trying to get educators retained and recruited, as well as talking about some of the pre-service components. So the first one there, the first and second one kind of go together. They'd like to compensate certified staff at 85% of comparable professions and provide an ongoing cost of living increase for certified staff. And then the next two are really focusing on the pre-service programs. They would like to expand the University of Wyoming teacher programs to reach rural Wyoming and work within our community colleges to provide both in-person and virtual instruction for that support of place-based individuals that are interested in becoming teachers. And then the next one is they'd like to get field placement sooner. So they want to get those pre-service teachers into the classrooms sooner than they are currently. And so this working between the University of Wyoming Community College and school districts to help make that happen, along with including some behavioral management strategies into that pre-service program. Back to Laurel.
Mr. Chairman, just to kind of finish this off, as you know, the superintendent's strategic plan has a whole section around valuing and supporting teachers. They are also reviewing these recommendations and looking at how to take these recommendations and provide guidance to us on where to start and kind of how we might want to look at implementing the recommendations that are coming from this task force. We do want to make sure you're clear too. We have taken in significant stakeholder input as we created these recommendations. We have almost 40 people on the task force itself, representing people across Wyoming, as well as having had significant input from the survey and things like that. So there's been a lot of feedback given to us along the way too. Thank you, Mr. Chairman. We're ready for questions now.
Questions on this? Yeah, I'm going to ask several. Representative.
Thank you, Mr. Chairman. Can you go back to the part where you're talking about adding staff to each school and school district? So just so I can get those numbers straight.
So, Mr. Chairman, they were focused on mental health professionals. The focus in their discussion was around the fact that much of what they're dealing with are behavior issues in the classroom. Some of it's mental health, but some of it's just behavior issues that students have. And so they were asking for schools, so their request was to have at least one mental health professional and one behavior specialist at the elementary school for every 250 students, and then having one school psychologist and one behavior specialist position for every 250 students at the middle school and high school level. And then they wanted to make sure there was at least one school psych, mental health professional, really, I think, and then behavior specialist in every district.
Thank you, Mr. Chair. Have you done the math? How many employees are we talking throughout the state?
Mr. Chairman, I have not done the math on that yet, but we can come back with that.
Do the math on. And frankly, that's a big resource issue, probably will be dealt with in the course of the recalibration. So one of my questions is that best done by hiring additional personnel in the schools? Or I've seen it done by district contracting with their local mental health centers. I know they did that in Casper for a number of years. I don't know whether they're still doing it. Why is the approach of having more people working for the school district superior to contracting out to the people whose job it is to deal with mental health?
So, Mr. Chairman, I think there's two different things that are in this recommendation. One is behavior specialist, which is different than working on mental health concerns that we have with students. And so the behavior specialists actually focus on helping kids with behavior, like just working on their behaviors to be able to better function in the classroom and with their peers and their teacher. Mental health professionals, I mean, I think you have to think about it if you think about the way we think about things in education. We frequently think about them in terms of tiers of service. So there are things that you're going to want to, tier one, that you're going to want to do for all students. And so frequently the counselors in schools and stuff like that are focused on helping kids with general life skills and suicide prevention and things like that, right? And I think that's what they're looking for here, not necessarily someone that can start providing clinical services and therapeutic services to students. Those, I think, for the most part, if they can find someone to do that with, that's where they would like to do. They'd like to be able to, when you get to that level, which now you're starting to talk closer to like a tier 3, pretty intensive services at that point. I think they're looking for things to be able to support students across the school on more basic mental health and needs and wellness.
Are there, we give the districts a block grant. To what extent are the districts at this point spending money on these kind of services? Statutory obstacles to their doing so?
Mr. Chairman, I don't know of obstacles. I can tell you, and I'm sure LSO could probably give you better detail. I do know we don't fund school counselors at the elementary level. We fund them at the secondary levels only. So I can tell you that. I can tell you districts are trying to find folks that can do this. I will say some positions go unfilled. I am certain there are school districts superintendents behind me that can probably answer the question of what they do much better than I can, but they do have that capacity if they choose to. But I think it's clear that, it is not funded at that elementary level.
That's going to be an issue we're going to have to deal with going forward because, frankly, with the block grant, you can't just add every time somebody has a good idea. You just can't add things. You're just increasing the block grant because the districts spend it any way they want to. So the overall question is the size of the block grant too large or too small? And that's what it's going to come down to. And so it's going to be more than the specifics of this. It's how important is it to the districts, and are they showing that it's important by spending money on it?
Thank you, Mr. Chairman.
Representative. Go ahead.
All right, thank you, Mr. Chairman. Kind of to follow up on the behavioral specialists, is it true that the special education area has a high need for behavioral specialists? Is there possible funding for some of that through that? just trying to connect ways that funding could come from some other sources, for particularly behavioral specialists.
Mr. Chairman, I'm sure it is if it's put as a part of their individual education plan, right, in their IEP. If those if that piece is a piece of what's in there, then absolutely. But I will say the schools are definitely seeing this well beyond the behavior issues, well beyond just special education students.
Yeah. Oh, and I wasn't implying that there might not be a great need. I was more responding to Chairman Scott's funding possibilities of joint funding, perhaps on some of those, or even like in more rural districts like mine that have some needs for behavioral specialists in the special ed area. And so, but again, making sense of whether you need a quarter of a person, half of a person, what, ever. So I just wondered if there weren't some opportunities there on the funding side.
Mr. Chairman, I'm sure there are.
Okay, all right.
Ready to move on to some of the, okay.
Thanks, Mr. Chairman. And thank you guys for these ideas, and thank the superintendent to bring up these ideas. On the mental health part, that last bullet, to create a robust and sustainable scholarship program. I'll give you an example real quick before I ask a question. My own daughter is just about finished with a school counseling degree. Very excited to go out there. She's paying her own, it's $25,000. She's paying her own, and she's going to come out paying her own. Wonderful. I'm proud of her as a dad. But for those who kind of already have done that, they wouldn't be able to opt into this, right? Is that something she couldn't take advantage of? Is this probably, if it even gets passed or thought about?
Mr. Chairman.
We think about those who've already, yeah, go ahead.
Yeah, I don't know that the task force really talked about that. I think it would be a matter of how it was set up. If you wanted to be willing to, if the legislature was interested in reimbursing for expenses, for having served in public schools for so many years or something like that as well. I mean, I think that would be at your discretion.
Thank you, Mr. Chairman. Here's the comment and the question. It's, how do we reward those who are thinking ahead and being robust about this and understand what to help out Wyoming, right? And help out their local communities. How do we reward those people? That's what I would like to think the task force. I mean, of course, we want more people in and attract those, but what about those who are being robust right now?
Mr. Chairman, can I respond? Can I respond to that?
Yes.
Okay.
Okay. Mr. Chairman, I think that when the task force was looking at this, they were looking, they definitely had a retention focus on this. In fact, I think when you look at the recommendations, the majority of the recommendations are really retention focused more than they're recruitment focused. I think they are all about, the task force was definitely about it's not just about trying to find new people coming in. We do need to find more people because we are down and we don't have enough as is, but it is also critical to find ways to keep those that are in the field and working well, like to keep them there. And that is many of what these recommendations are about, is how to support teachers that are currently working in the school. And I think they would have the same kind of focus and would be just as good on the counseling side as well.
As the committee knows, I chaired Committee 10, Labor, Health, and Social Services for a number of years, and we had issues with recruiting, retaining medical people like these counselors. And one of the proven techniques for doing it when you have a real shortage, it's not a matter of rewarding the individual people, it's recruiting the people that you need to accomplish state functions. And this is a classic case of it. You've got two well-known effective techniques. One of them they're talking about here you say if you will finance your education going ahead, if you choose to go into it and commit to coming back and functioning in the schools. Because of the 13th Amendment to the US Constitution, you have to give them an ability to buy their way out. And so you don't get 100% of them, even if they've committed, they go elsewhere, make more money, and pay you back for the cost of their education. That you have some losses that way, but it's an effective technique. Where people have already gotten their education, what is often done is a loan forgiveness program. Same concept, just intervene at a different stage. You say, we'll pay off your student loans or something, whatever it costs you to get the degree, if you'll come work for us for so many years, and that works too. So those are the techniques, but the schools have to have pretty good evidence that they can't recruit people that they need for this committee to go sponsoring that particular kind of legislation and have any chance of passing it. So any further comments on that issue? And then we'll have questions in the rest of the proposals. Cinder, right.
Different question. Going back to, you mentioned the whole child approach. I can't keep up on all the buzzwords these days. Is that the same as SEL, social emotional learning, or is this a new iteration of that?
I think the behind this is more around the fact that it is difficult to help kids that are struggling in the classroom with mental health needs, right? If they have, if they are struggling with behaviors, if I am in a classroom if I'm a kid in a classroom and I'm acting out in a kid with 20 other kids, it's really hard to address the academic needs of all the students there if we're not addressing the behavioral needs. I don't think it's necessarily just SEL. I think it's just thinking about if you look at every student, what do they need all around, not just focusing on like math and language arts.
Follow up. Would you say that things are getting better or worse in the last 5-10 years?
Mr. Chairman, the reports that I hear from school districts, especially since COVID, is that behaviors are certainly getting worse and mental health needs are getting worse on top of, and we've also have dealing with recovering the academics from what we saw from the losses that came from COVID in schools. Kids were out of classrooms.
So, Mr. Chairman, it appears to me that the social emotional learning that we've adopted in the last few years with this whole child approach maybe not being very effective, and it might be time to relook at that approach, that maybe going back to an academic approach, dealing with behavior issues like we used to, remove them from the classroom, they're being disruptive, and focusing on academics. And maybe SEL is not working, and why double down on it? That's just my opinion. If there's not any scientific data that supports that it is working.
Going to raise a couple on the micro credentials. The question I have is, you're talking about micro credentials from the University of Wyoming. Will that include involvement from the community colleges? Because you've got education programs in all the community colleges, and one that's more spread around the state than the university. And it may involve the university's various outreach efforts. That'll make it much more accessible to the teachers, because I can see the value of that.
Mr. Chairman, absolutely. I mean, I think the idea around here really was focused on the idea of, instead of doing professional development that is not connected to, if I'm the PE teacher sitting in a language arts professional development, it may not be overly useful for me. And so the idea is the task force was thinking about that idea of personalized learning, so that the professional development meets my needs as an educator, and is focused on the areas of growth for me that are important. I mean, that's part of what I think they were focused on. And part of it was around competency-based, which is what micro-credentials are. They're a competency-based form of professional learning. So that by the time you come out, it's not just a sit and get. I didn't just go to a conference. I didn't just sit in the gym and listen to someone talk to me. That I actually am showing and proving and going through that process of growth and reflection to really demonstrate that I have built the skills that the competencies that are being measured in the professional development. That's really what it's focused on. Anyone can do it. The department, this is what we did for the computer science and getting computer science teachers certified. It was the alternative pathway we worked with the Professional Teaching Standards Board on, and I've got over 100 educators at this point, either having passed all, earned all 17 of their micro-credentials and now have their certification, or they're working on it. And they're finding the results that we're seeing from that are phenomenal. Even during the COVID era, teachers were talking about, after having completed their micro-credentials, that in a time where we're seeing teachers fleeing the field really in education across the nation, these are teachers that were 95%, 97% were saying they were more excited about teaching after having completed this, even in the middle of dealing with all the stuff they were dealing with in COVID. And so there's a lot of value, I think, in this form of professional learning, and it can be done by the department, it can be done through UW, it can be done by the community colleges, and it can be done as a partnership of all of us.
I will make one suggestion in this area as a potential. I think it could be called a micro-credential, but in the mental health and behavioral area, a lot of the very serious mental illnesses, schizophrenia being one of them, often express themselves either as an individual is going through puberty or as a young adult. So a lot of the first expression occurs in your high school and even on occasion your junior high students, and you can get a very acute psychiatric breakdown suddenly and unexpectedly. There's a mental health first aid program that teaches, frankly, people like teachers and others that are likely to be in contact with these individuals, what to do if that happens. And, eventually the kid needs very professional help, but you got to deal with the acute crisis in the classroom. Is that the sort of thing that you're likely to get into with the micro credential, or are you envisioning something much more complicated than that?
Mr. Chairman, I think the micro-credential just measures that you have competencies in dealing with it. We are already partnering with the Department of Health and providing the youth mental health first aid and some other similar type trainings for school districts, and we are finding phenomenal participation from the communities and the schools and teachers and the like.
Okay, committee, further questions? Representative Lawley.
Thank you, Mr. Chairman. And you may have covered this and I just kind of missed it, but where does this go from here? What's the process now that these recommendations have been made? What happens next and then after that?
Mr. Chairman, Representative Lawley, so our first step we took was to take these recommendations, and we are working with the superintendent's cabinet on valuing and supporting teachers. So they've gone through them. They're starting to prioritize the ones that they see as most important. They definitely had a focus on that early mental health and the early childhood piece, that they saw that as a critical piece. And the other one, what was the other one? What? Oh, the partnership, the getting the pre-service teachers in the classroom earlier. Those are the areas that they asked us to focus on, and we'll continue to work on with them on what these look like and continue kind of picking off the ones that we are able to work on. I mean, certainly things like the ones that are funding model connected are ones that you will have to decide what you want to do with.
I'm not hearing you making at this point, specific legislative asks other than in the funding area that I think we will deal with in the recalibration.
Mr. Chairman, I believe that is accurate.
And do understand that if we get into, we can't deliver the mental health services, no matter how, what the mechanism is, whether it's through the school district or the school district contracting with mental health providers, then there are some known techniques we can come to, but we've got to have good supporting data that the school districts are trying to obtain services and simply can't get what's needed. And absent that, we can't sell a loan forgiveness or a scholarship that you pay back by working in the school district. We can't sell one of those programs absent evidence that we have a severe shortage that's harming the districts. So that's something to keep in the back of y'all's mind as you go forward. Anything further on this before I call for public testimony? If not, thank you very much. We may have, after we've heard public testimony, we may have a few more questions for you.
Yes, sir.
Anybody else, anybody here present want to speak to this issue? Okay. And give us your name and who you represent and proceed.
There we go. I'm Teresa Chalk, Superintendent, Lincoln County School District Number 1, and I'm also on the cabinet for valuing and supporting teachers. I just wanted to come up here to talk about two questions that you kind of mentioned at the end, Senator, Chairman Scott, and committee. When you asked about contracting with mental health services, I just wanted to state that there are capacity and access issues for a number of districts. If you live in a larger community, you have access, but if you're in a remote community, you do not have access to that unless you're doing it via Zoom or you're transporting your child an hour each way. So I just wanted to mention that. And then you also asked if we were using our block grants already to support these needs. And I would say that every district in Wyoming is funding elementary counselors, which is outside the model. So those are the 2 points I wanted to make. And then on compensation, as Robin mentioned, was the number one issue. The Valuing and Supporting Teachers Committee has not addressed that at all yet. So I just wanted to make those comments, and then I'll stand for questions.
At Lincoln 1, which district?
That's Kemmer.
That's Kemmer, okay.
I always say Lincoln, not LCSD, so you don't think I'm Laramie. And I mean that in all loving kindness.
We can understand that, how that confusion could arise. Okay, committee, any questions?
Yes. Thanks, Mr. Chairman, and thanks for being here. Is it true when if you do contract to private groups, is it more money to contract to private rather than having a counselor or let's say an OT or PT services?
It is true that it would be more per day. Like if you only need a part-time FTE at the end of the day, it may be less money. But if I need to contract for a full-time OT, full-time speech, full-time licensed counselor, it does cost more.
And so, Mr. Chairman, follow up. Thank you. So you would like, if you have to full-time, you would rather have a district or an employee, correct?
Chairman, yes, it's always better to have an employee that works for the district.
Thank you.
To be financially responsible.
Thanks. And following up on that, we talked a little bit about the challenges of recruiting. How challenging do you find that if you're advertising for a position in this space? How difficult is it for you to attract and recruit?
Well, Chairman, I can say that we've advertised for a business teacher for 6 years. We finally got one. So It took 6 years to fill that position. We've advertised for an OT. We lost our OT probably 8 years ago, and we've been filling that with a contract position, but we still only get the OT 1 day a week. And I'm finding to have a quota, they're going to charge to meet the students' needs. They're going to charge me $50 an hour for a quota, which is more than I pay my contracted OT. So it's very difficult. And then Dustin Hunt wanted me to share a story. They're looking for a band teacher. They had a band teacher or a teacher apply, but he also is an insurance salesman, and he turned him down because he makes more money selling insurance than he could to come teach. And remember, I know this cuts both ways, but our teachers primarily work 185 days a year. That's what their salaries covered. So, but we know, I believe that our teachers hurt themselves when they fill out those surveys that you guys get saying, oh, we work 8 hours a day. I don't think our teachers think when they're sitting in their recliner grading papers or lesson planning, they're not counting that because they're not paid. But I was a teacher before I was an administrator, and I'm available 24/7. Try it out anytime on my cell phone. But our teachers, they have to work. And in Kimmer, if you're not working 10 to 12 hours a day, you're not going to make the cut to even be tenured, because it takes that dedication to make the difference with the kids.
I have a question.
Chairman North.
Thank you, sir. So would micro-credentialing in health help? Could we get to where we have like the tier 1 level, as was asked about? Could we get that within a particular person within a district that could get a micro-credential and then be able to help in your districts?
Chairman, I wish Brendan could be here. My concern with micro-credentialing is whether or not it's going to work and they can get certified to meet those specific needs, like for behavior. But more to your question, micro-credentialing, if we can provide the PD, that goes back to the PD part they talked about. Yes, that would help give teachers the skills they need in the classroom to mitigate the disruptions in the class, but not resolve them. Does that make sense?
Yep. Okay, can I have another question, please? Okay, can you tell me, it's been a while since I was a school board member. Can you tell me when we started learning or started teaching by social emotional learning?
Chairman, I'm going to say, in Lincoln 1, social emotional learning became a buzzword. I'm going to say 5 to 8 years ago. And in response to Senator Beitman's question, I don't think we've had trained people to know whether or not SEL is going to make a difference. I know in our district, the only way we can afford to have SEL is our counselors create mini lessons and, go once a week for 30 minutes a day in the classroom. So we've not been funded to even know if that's going to make a difference.
Okay, thank you.
Thanks, Mr. Chairman. You said that I heard business teacher, I heard band teacher, but from the department I'm hearing special ed or science or math. Are you kind of finding that finding teachers is getting more broader than just real specific
Chairman?
for the shortage?
Chairman, yes, it's really broad. Special education teachers are really hard to find. This year, we're short one going into the year. We have one teacher, thank goodness. She was an elementary ed. She went to get her degree in special ed, and we did not pay for that. She chose to do it on her own. And then we have a homegrown student who finally graduated. But it's all across the board. You ask, I think I'm the only soup here, but most districts are going into each school year with teachers on exceptional authorizations or long-term subs. Last year, we couldn't hire an English teacher. We had a long-term sub all year for English. This year, we couldn't hire a math teacher, so we have a science teacher with an exceptional authorization teaching math. It is all across the board as far as the difficulty in recruiting teachers.
Anything else? Thank you very much.
Thank you.
Appreciate it. Anybody else? Anybody else? Now's your opportunity to talk to us. Seeing nobody, committee. Any further discussion on this? Let me suggest a couple of things. First, let me say I'm impressed in the teacher retention in most of the items. I think particularly in things like the micro-credentialing, some of those things I think that kind of professional development makes the profession more effective, more appealing, reinvigorates your teachers. That really looks to me like you're doing some good work in pursuing those things. And I want very much to encourage the department and the PTSB to continue to proceed and pursue those and come to us if there are any problems that I don't think you'll need law changes, but if they arise, come to us. Let me make one suggestion. You want to add to the accountability indicators. I would say be wary of that. Frankly, this is some of the area of my professional expertise when I got my MBA way back when, dealing with accountability and control systems. They're difficult in the public sector because you don't have the profit measure that's available to the private sector. And you have the need because we humans get fat and lazy and need to have some objective feedback as to whether we're doing things effectively. That's the point of the accountability systems. If you make them too complicated, they tend to be ineffective. It's like making everything a priority, which we're seeing as a problem in some other areas. So be wary of adding things to what's already a system that's complicated enough so we aren't seeing it used the way I think it needs to be. That's a caution I would give you. And on re-envisioning, that language covers a multitude of possibilities. If you re-envision education by saying, we've got to get back to the fundamentals and make sure all our kids are learning how to read, make sure all our kids are learning the basic mathematics, I think you'd see a lot of support for that. If you're going to ignore those fundamentals and go off on some other tangent, we wouldn't support that. I don't know, committee, anybody want to add anything to that? That's because I'm giving you my opinion there. Representative Berger.
Mr. Chairman, just on the note of retention, I just want to thank those teachers who are staying in the field, who realize that it's the best career there is. I'm talking about myself. I'm talking about those who are staying because they're fighting a fight. And they do like teaching, reading, math, but they also deal with kids that are coming from homes that they're getting hit, beat. They don't get dinner. They don't get breakfast. They don't get lunch. And that's not easy. But I want to thank those teachers. On the aspect of recruitment, I want to thank those young kids that I taught, or even my own children, but I see still, that want to be teachers and see how much of a rewarding career it is. It's awesome. And that are going to the because I'll tell you what, in Evanston, we're recruiting, our teachers are coming from the University of Wyoming. And those kids that are coming to teach with us are from your communities. It's been great. And we're not getting them from BYU and Utah State, because they're wanting to stay in their communities now, because those states have caught up to what we're paying and similar to that, which is fine. Good for them. Wyoming offers a unique lifestyle. And I just want to thank those kids that want to go into that profession. Come on, keep doing it. Mr. Berger, you want to ask me about a great profession? This is the greatest profession in the world. You need to know that. The teachers that are here, myself, I just love it. It's wonderful. And if any of you want to come to my classroom, please come see what's going on. Come see you want to see very severe disabled kids. I'm going too much, but anyways, it's very hard, but I love it and very rewarding. So keep up the great work, teachers that are staying in, and those who want to be teachers, keep doing it. If you ever have a question, contact Mr. Berger, because I have no problem answering. Thank you.
I will say that one of the things I'm hearing anecdotally is those districts that our accountability system is identifying as doing a better job are having an easier time with teacher recruitment and retention because the teachers want to be in an environment where they're actually accomplishing things. And that is helping. Did I see Senator Office and then Representative Provenza? Okay.
Thank you, Mr. Chairman. I just want to thank Dr. Ballard for bringing your expertise to this and having an evidence-based approach. Having heard you start with the literature review I think, tells me a lot about how you went about this process. So thank you. You know, the committee took mental health off of the agenda, and I think that there's probably a lot of other things that we heard about in May that can be addressed at some point. Whether this committee does that or not is a different question. So I guess all I'm wanting to say, Mr. Chairman, is to members of the public, for things that this committee doesn't get done in terms of mental health or issues that relate to teacher retention, know that I would invite you to speak to me to talk about how to come up with solutions for folks in ways that maybe this committee is not ready to pursue.
And I will say mental health is still in our charge. This report deals with that in part. So we will continue to hear things on that. What we're lacking at this point is a specific legislative identified direction that is not already covered by the Committee 10 in the mental health area and the various task forces that created. So, Senator Office.
Thanks, Mr. Chairman. And I think on that point, Dr. Ballard was a part of the work in creating the Wyoming Accountability and Education Act for all the years that we worked on that through the Select Committee. And I think the recommendation of re-envisioning education and revisiting that ties into mental health, and I appreciate that point. And I'd be curious to see that built upon for recommendations, because as I see it, Committee number 10 is focused in their mental health endeavors on addressing emergent mental health needs as opposed to preventing those mental health challenges in the first place. And a lot of the pressure that we put on our educators and our students come through the Wyoming Accountability and Education Act as an unintended consequence of what we built. So as these recommendations are contemplated, I appreciate both the mental health and the re-envisioning education, because I think that is a big part of it. Committee 10 is not going to do that. That's up to this committee to contemplate where have we put too much pressure on teachers and students through the Accountability and Education Act. How can we reduce that pressure, reinvigorate the joy of learning, the joy of educating, and do that in a way that still allows us to get the data that we need. And at the same time, maybe take the pressure off so that it doesn't feel like that's all we have to be focused on. I would love those types of recommendations. And I know that as somebody who's instrumental in building this, I think you're exactly the right person to bring back those recommendations. So if we can understand a little bit better what this committee can do to reinvigorate that joy of learning, I think that would be wonderful. I appreciate your efforts in this, Dr. Ballard.
Some of us think that it's not a matter of taking the pressure off, it's a matter of putting it on so we get better performance. Because we are not seeing from a lot of the districts the kind of performance we need to see. And I think it's a management problem. So That's a matter we can discuss at some.
Yeah, I think I'd like to see the recommendations and then debate that, because I've never seen a circumstance where adding more pressure was a key to solving the mental health concerns. And at the same time, I do believe we have improved test scores through the emphasis that was put on accountability in education, but we see the consequences of that through the mental health. So we optimized for something that, honestly, I know that you have been disappointed in the performance of the state, but I think this is an area where you and I have disagreed over the years. I think being the best in the country on NAEP scores is something to tout, to say, hey, good job, teachers, we succeeded. But what were the unintended consequences that come along with becoming the top performing education state in the country? And I think what we did was build a little bit of a mental health crisis along with it. And I don't think we have to sacrifice necessarily one for the other. And that's where, again, Dr. Ballard's expertise is something that we can rely upon with her experience, as well as being part of the team that built the Accountability in Education Act. So I think we should get those recommendations and debate that, Mr. Chairman.
I really think that we're seeing a number of our districts, and you've heard the list: Sheridan, Cody, Powell, Worland, Big Pine and Green River. All those are producing much better results, as near as we can tell from the assessment testing. They're producing much better results than a number of our other districts. And I can't see any evidence that they're having, because of that, more mental health difficulties. I'm just seeing poor performance. And poor performance, it looks to me like, is a function of the management of the district. So I guess we're going to have a disagreement on that. But the purpose of our school system is to educate our children, and we're leaving too many of them behind. And I don't care whether we're leaving fewer behind than the rest of the country. We aren't quite the top, as I understand, in NAEP scores, but we do well compared to everybody else. But we're leaving too many kids behind. And people have that criticism of the American education system in general. And that's where you're seeing the push for some of the school choice coming from. The parents are concerned, but rightly concerned, that their kids aren't getting the education they need in some of the fundamentals. So it does seem to me we need to put the pressure on and figure ways that the other districts can imitate the successful ones.
So, Mr. Chairman, when the Accountability in Education Act was built, one of the concepts that was built into it was a comprehensive system of supports, where the lesser performing districts were to receive support through the Department of Education that would help to build them up. So we put together a testing regime, and then following that testing regime was supposed to come resources that would provide that comprehensive system of supports through the Department of Education. So that's all in statute. The reality is that system of supports didn't really materialize because it took additional resources that were never provided to build that comprehensive system of supports. Chairman Northrop was involved in all of that. Dr. Ballard was involved in all of that. So it's not to say that the system didn't understand exactly what you're saying, where we would have successful districts and then they would have lesser performing districts. And you mentioned this, I think, yesterday or at least certainly recently, the idea that these high performing districts could serve as models for the underperforming districts. That was also built into the legislation. That comprehensive system of supports, though, again, is something that never fully materialized. And if we wanted to implement the vision that you're describing, that would probably be the area to focus on, which is best practices from the high-performing districts facilitated through the Department of Education to provide resources to the underperforming districts as kind of the carrot and education as opposed to the stick. But again, I would say it was never fully implemented. I'd ask Dr. Ballard for your views on it. Again, you've been in the department for the whole time. My understanding is that we just didn't resource it over the time, and we didn't have enough people working on the accountability support network to achieve that. So, Dr. Ballard, what are your thoughts on that?
Mr. Chairman, I'll give my best to my ability. I think that, we have a state system of support. We do work with the State Board of Education on as well. And in the past, we've done things like training districts and looking at how to do proficiency scales and and those kinds of things. And I think that has helped districts as well. We've worked on providing supports around professional learning communities, so bringing teachers together, focusing on data and looking at student needs based on data. I think that's the School Leader Academy that's on here. That is getting ready to kick off this year, and I think that will actually be huge. And I think it addresses all of what you've been talking about, including Chairman Scott, right? Like that there has been a hole and a gap in the training for principals, after they come out, right? In the professional development, there's been a huge gap, I believe, in the state on that, which is why we're looking at building that academy. And it's why it's showing up here, because teachers have principals that are doing the best they can, but they don't have all that they need to be able to effectively support them sometimes. And so creating a system of and a network of supports and professional development for principals and other leaders in districts, I think will be actually incredibly important. There's definitely, we're doing more work, both the governor's office and the department, on looking at competency-based learning and student-centered learning. Another buzzword, I suppose, but it's all about really thinking about putting the student at the center and making sure that you've got, that you're meeting those needs and making sure they have the skills and those competencies. And I think that's part of what I wanted to come back here and think about too, is we think about that, the relevancy piece that we talked about. I'm going to just give you an example. I think most of you know that I worked on computer science, I don't know, for years now. We've been working on micro-credentials and competency-based learning for teachers. We've been doing the same for students. And we started asking students this year about, after they've been doing coding robots, doing machine learning, right, and understanding how to code, that kind of stuff, and just doing general coding, and asking if they understood how that connected to jobs outside of when they leave school. And they're a large majority, well over like 80%, were coming back saying, I don't see how this connects to what I'm doing. And I fall over just in shock, because I don't know how computer science could be more obvious. And the still kids, and this is from a teacher's classroom who is incredibly passionate about computer science and passionate about her kids learning it, has gone to great extents so that she has the skills to be able to do that. And this kid still couldn't come out talking about how this connects to that kind of learning. So we talk about the relevancy and those kinds of, and making that, that's what we're talking about, right? Like, at least that's kind of the things I heard, just kids are not making that translation. And so I think the question is, right, sometimes about if we are killing on assessment versus really kind of showing them how to do the work and then making it connected. And when you can connect it to something else and to something meaningful, then it makes it more sense and you have more excitement. My own daughter is an example of that. Through the computer science as well, right? When she learned she needed it in college, she wanted to take it in high school. And so I think those are some of those pieces too. My last thing, Mr. Chairman, and then I'll happy to stand for more questions if there are any. The Mental Health and Vulnerable Adult Task Force is also meeting today at 3:00-ish, knowing how committees work, we're supposed to be talking about the mental health in K-12. My team and I are going to be talking about starting from Tier 1 all the way to some of the most complex cases, the pieces that we have in place and supports and things that we've been learning about what works and what doesn't in around this area. So if you want to join us because you haven't had enough over the last day and a half, certainly we would love to have you there too.
Quick question. We had some presentations, I think, last year from districts that were turnaround districts that performed low in the Accountability and Education Act, and then through the system of supports ended up going from underperforming to I think exceptional, if I'm not mistaken, to advanced proficient. Maybe getting a look at that also, if we have that data available, would be something that would be beneficial for the committee to see it at the next meeting, to understand how that comprehensive system of supports is working. Because I know at least in one case, and I wish I could remember which district it was, maybe you remember, maybe somebody here does, it was quite an exceptional turnaround. And I know that this process was successful, the accountability process was successful in that district, moving forward, learning where their deficiencies were, and then dramatically improving their outcomes. So we certainly have some success stories. Thank you.
Meeting other than, we'll have the one on the external cost adjustment. And then the final formal meeting of the committee will have to concentrate on the specific legislative proposals. But I think we're going to find that hearing from districts has been very productive for this committee. And I think we'll probably continue doing that. At the last meeting always has to concentrate on the specifics of the legislation. But going forward, I think we will probably continue to hear from specific districts, because that's quite useful in terms of understanding what's actually going on. At this point, I think we've exhausted this topic and strayed, and you can see there is a philosophical disagreement within the committee on the overall, but it does look like I don't hear a specific legislative ask in this area other than funding that we will deal with through the recalibration. That's the way we've got the system set up. Thank you very much. Appreciate it. And I think it's now time to turn to the reading assessment, and we'll, if the group on that will come forward, I can see them back there. We'll get started on that. And then about 10:30, we're going to take a break, and then we'll go to the early childhood, even if we haven't finished this up and have to come back to it. So, okay, go ahead, identify yourself and who you're with.
Good morning, Shelley Hamill with the Wyoming Department of Education. I'm the Chief Academic Officer there. I'm here to provide the required update on Wyoming Statute 213401, reading, K-3 reading assessment and intervention, specifically the implementation of the 2022 Wyoming session laws. So we're going to start with a recap of the rules promulgation process, just a little bit of a brief history, and then a review of the public comments about the proposed rules that recently just closed for public comment. So as you might recall, the stakeholder committee that was required by the statute met numerous times during the year of 2022, and they developed the required screening and professional development requirements and criteria to be promulgated in those agency rules. Once the committee had compiled the recommendations, they were shared with various Wyoming educational stakeholder groups to solicit feedback. With the recommendations from the committee and the input from the stakeholder groups, the WDE staff then did draft proposed rules. The draft rules have been reviewed by the Wyoming Attorney General's office to ensure alignment with the statutory requirements. The statute requires that Wyoming school districts, I guess I should preface that a little bit by saying that there are two places where the rules they extend what's stated in the statute, because we're directed to do that in the statute. Otherwise, they mirror almost identically the statute, the language in the statute. So the two places where the rules expand or elaborate as directed are the areas around screener and professional development. So the statute does require the Wyoming school districts administer a universal screener to every kindergartner through third grade student 3 times each school year. And further task the WDE and stakeholder committee to identify the criteria that would be used to approve screeners for districts selection and use. The statute also called for the identification of professional development content and quantity requirements for educators in the kindergarten through third grade space. So there are attachments to the memo that was provided. Those should look pretty familiar. Those were from the May meeting. I'm happy to go over those again, or if you have specific questions, I won't dive into a deep review, just be respectful of time. I'll continue with the.
Okay, go ahead, Senator Office.
Just briefly, I'm curious about the implementation timeline. Are we expecting, and maybe it's implied here somewhere, but is this all going to be rolled out for this school year starting in the fall? Are we expecting it to effectively be implemented for the upcoming school year?
Mr. Chairman, Senator, we would anticipate yes.
Okay, thank you.
So the proposed Chapter 56 rules opened for public comment in early June and closed last week on August 31st. The WD also hosted 2 virtual public comment opportunities the last week of July. The WDE received 48 written comments and a total of 5 oral comments between the 2 virtual opportunities. The written comments were collected in alignment with the sections of the proposed rules, and the oral comments were also divided out that way as well. And I'll just provide a little bit of a review for you so you have a deeper understanding of where those public sentiments are right now. So for the first section that's titled Definitions, the WDE received 10 comments. Some shared that there were far too few definitions included in the proposed rules. Some provided feedback about having greater precision in word choice, while another encouraged an alignment of definitions among other WDE documents. We received 43 comments on the universal screener section. Common themes for this section included concerns over lost instructional time, a lack of correlation between the predictive skills screened for with the end of the assessment being the Y-top at third grade. There seemed to be a lack of a universally applied definition of a screener, as some commenters spoke of a screener as a diagnostic or a progress monitoring tool, asking for there not to be a limit of time for that to be implemented. So the criteria for the screener was suggested that it shouldn't take any longer than 10 minutes at the end of third grade when you're assessing for comprehension. And I think that was one of the keys that helped us to understand that there's a lack of that universally applied definition. Let's see. There were some that desired more flexibility in the screener criteria, wanting to include adaptive tools, while others supported the elimination of the adaptive tools or measures to preserve the technical adequacy and the standardization of the results. There were concerns expressed about using the publisher's defined cut scores to determine level of risks, and then a desire to select their own screeners. The next section was about evidence-based intervention and curriculum, and there were 29 comments for this area. The main theme for this section was the idea that the wording in the proposed rules, which again mirrors the wording in the statute, implies that districts are supposed to select a boxed curriculum from a publisher. So that was uncomfortable for districts, as they recognize that they may have selected a curricular package from a publisher for their tier 1, but then as they add and build to their literacy program interventions and things, that they were being limited to be able to do that. So there was some concern there. There were a couple of requests for a list of recommendations of approved materials as supports for districts. The section that was titled Individual Reading Plan and Parental Notification received 11 comments. 3 comments about clarification, one expressing frustration about districts not selecting the correct interventions to address specific needs. So that was an interesting one. And then one speaking of the damage of relationships with parents, should the district be required to notify parents of young students? But overwhelmingly, the other 7 supported the notification of parents as written in the statute and the rules, proposed rules. There were 32 comments then received on this section titled Professional Development. The main themes here included concerns over the costs associated with the required professional development, the challenges for districts in tracking the compliance of the required hours for the variety of different educators, the desire to have all elementary teachers participate in this requirement, not limiting it, the requirement just to K3, recommendation to simplify this section, concerns about this requirement limiting other professional development opportunities, knowing that districts have a limited number of days to provide professional development. And then the recommendation to remove the professional development requirements around literacy from educators in the K3 space that are not directly teaching reading. And then there was a couple of expressions of appreciation for the broad span of literacy topics that were named in the professional development categories. And then the final section of the rules, public comment, was around the reporting section, and it received 12 comments. Again, there seemed to be a disconnect between understanding what the statute was requiring and the idea that the rules were instead the format for requiring reporting. So having said that, there were still 2 main themes that were captured through the comments. And the first was the question of if the YTOP was the appropriate measure for the statute. And the other is the idea of an exemption from some of the requirements required in the statute for high-performing districts. General comments that showed up, but didn't really apply to specific sections, including, again, that the frustration that the rules and the statute only address kindergarten through 3rd grade, knowing that there are students that go beyond 3rd grade that still have some significant needs in the area of literacy development. And then again, the desire to find a way to preserve the practices of districts that are high performing on a consistent, regular basis. So that leads me next into the policy recommendations of the memo. Even with the changes that have occurred over the last handful of years to this statute, there is still a current interest in additional revisions to the existing statute. This was noted last May as Superintendent Degenfelder presented her strategic plan and introduced the idea that there would be a literacy cabinet organized to consider the things that she heard from districts as she was traversing the state. So the strategic plan literacy cabinet has been organized, and it met its first meeting last week to begin the work of making those recommendations for change to the current statute. So they heard a review of the public comments, just like you just did in regards to the proposed rules, as those rules are a mirror of the statute. They also heard an update about the state's participation in the Hunt Institute's Path Forward, which is an effort to support states in their work around improving literacy. You may recall at the last May meeting that I provided an update to you all about that as well. And to summarize the discussion then of the literacy cabinet meeting last week, there were 4 main ideas that initially coalesced into recommendations or requests. And I do want to just pause for a moment and say that not everyone could be there. There were 3, I think, members that were unable to attend. I was able to have a follow-up call with one of those individuals to be able to provide an update about the discussion. And, in light of the requests coming from the committee through LSO to WDE to be prepared with some recommendations, the committee dove right into that. The cabinet did. So I just want to share that the first recommendation then is grounded in the recognition that accurate and specific data should be driving policymaking. It's really important. We currently have a statute that requires various pieces of data that are practically impossible to use to draw conclusions and influence policy. This difficulty is compounded by the fact that as a state, we did not choose to identify and fund just one screener to be used by all districts. We fiercely want to protect that local control and provide districts with the autonomy to make decisions that best fit their system within the bounds of the statute. The cabinet, though, believes that we need a data collection system that allows for this autonomy, but also provides comparative data if we are to identify model practices within our state and then to be able to scale those practices out to other districts to support them in their achievement of higher outcomes. They further believe that that we have a need to have correlate predictability between the screening instruments that districts are choosing with the YTOP. We need to have correlate crosswalk between the various screening and progress monitoring tools that districts are choosing, should we be able to use this data in any type of an effective way. So the recommendation from the cabinet is to provide support to conduct a study to determine what specific data elements should be collected to inform policy that could drive better district practices. This could then potentially lead to a system that collects and reports data through some sort of a dashboard, which would provide a higher degree of transparency. This could include also not only the screener data, but progress monitoring as well. That leads then to the YTOP. The second ask then is to slow down the continual changes to this statute, short of cleanup, to allow districts to implement current requirements. Districts are working to improve their literacy programs, but continual change doesn't provide the time necessary to see improvement. So I mentioned earlier that the Literacy Cabinet will meet 2 more times before we meet again in November, and they may have additional recommendations about cleanup language or specific recommendations. But there was a theme there that we just really need to kind of slow this down and let districts, knowing that it takes 3 to 5 years to see systemic change.
Thanks, Mr. Chairman. Ms. Hamill, on that last point about being able to correlate and being able to have kind of a statewide analysis, was there discussion about the fact that, the intent of this K-3 screener is not necessarily to be a part of our Accountability and Education Act and to have longitudinal data? It really is to identify students that need specific interventions and then make appropriate interventions. My concern with the emphasis of trying to make it look like an Accountability and Education Act, at that point, you want people to perform well. You want your scores to be good. There's a natural inclination of worrying about the good chairman saying, well, this district is underperforming, when what we really want from those tests is for them to identify the students that are underperforming and then fix that so that when they get to that 3rd grade summative assessment, they score well. So it seems to me that literacy cabinet kind of has the wrong motivation in mind potentially with what we were trying to accomplish with this K-3 screener, which is not for us to lord over it and say, well, you're not doing well enough in this district, but for the district, for the teachers, for the people that are engaging with those students to quickly, immediately identify where there might need to be interventions and then make those interventions. And I guess I'm concerned with the message that's being provided from the first session is that we want uniformity so that we can use it for longitudinal assessment.
Let me add to that. I think Senator Ruffus is really speaking probably for the vast majority of this committee on this issue, that our purpose here is to get the students better served. And the question I would add to what he's asking is, do we really want to require 3 screeners a year? What's the purpose of the screener? Is it, the teacher knows by and large whether the kid is learning, and I see the screener is giving the teacher ammunition for, objective ammunition for talking to the parents about individual problems with individual kids, is it going to serve that purpose? And do we really need those 3 screeners a year?
Mr. Chairman?
Yeah.
I'm happy to respond to some of those. So I think absolutely the committee recognizes that the screener is being required and implemented as a preventative measure to be able to intervene early, to recognize when a child may not be progressing at the pace of what would be expected and hoped for. So that's what the purpose of the screener is, just to recognize through different periods of time if that child is not making adequate progress or performing in a way that we would anticipate on specific skills that correlate or have a high level of predictability to later literacy development, reading, being able to read. So the statute, though, actually asks for a host of other pieces of data that potentially would be addressed through a different data collection or something more specific, not necessarily just the screener data, right? That data, screener data, really is intended to inform that educational team, that teacher, to either confirm what you were saying, Chairman, that the teacher's gut check is that this child is not performing well. We do have some very, very skilled educators in classrooms, but having those hard data points supports what they're able to present, and it provides for an opportunity for triangulation of data. So it's just one piece, but a screener would not necessarily tie directly to an intervention, but it would red flag for the educational team, that teacher and other members, to determine if further diagnostic assessment is necessary. Did I answer questions?
Chief Academic Officer at WDE.
Yes, sir.
Let me ask bluntly, you've been working on implementing this. In your professional judgment, did the legislation we passed a few years ago, a year ago and 2 years ago that you're trying to implement, is that going to work, or do we need to change something in it? Are we, our objective is to improve the learning that the kids are actually showing and are actually getting in the whole area of reading. Is what we enacted going to solve that, or do we need to change something?
Mr. Chairman, I think that's a pretty complex question. Indeed, I think that the structure of the statute provides support for districts that to be able to continue to make improvements, and points districts that maybe not potentially don't have the in-house expertise to be able to provide some of those components. We have other districts that are at the other end of the spectrum, where they have very well-developed literacy processes and programs, to use the word from the statute, that seemingly for their district and their system, they're working effectively for students. I think that there's, speaking from my professional perspective, we didn't go far enough around the professional development, because we don't have funding then to provide coaches at the district level. If we really want that professional development to be impactful, it needs to be ongoing, it needs to be reflective. We need to have constant feedback to really support those teachers. And it's potentially coaching from experienced educators within the district or across the state that are able to really hone in and understand what needs to happen for a student, using data, using specific skills. I hope I answered that question. And then happy to at least get through the last recommendation from the committee or cabinet, if you like. Sure.
On the exemption. So go ahead.
Yes, so then that's exactly what I'm going to talk about right now. So hopefully that'll answer your question. So next is the recommendation from the cabinet that echoes the sentiments that were expressed through the rules comments to include language in the statute that would allow consistently high-performing districts to continue to implement their system without needing to conform to the screener or the professional development requirements that are named in the statute if they are already not pieces that those districts are using. So the cabinet discussed various options about what that language could potentially look like in the statute, all the way from, could this be the top quartile or the top 10% of performing districts being exempt from the screener and the professional development requirements, or should it be a specific threshold that all districts could potentially meet to be able to be exempt from those two components. That's not to say that those districts are not using systems to screen or progress monitor their students, and that they're not providing professional development, because they speak to the fact that they absolutely are, and that's why their results are as solid as they are. So they also recognize that there's a strong need to continue to have support for districts that are still working to improve their processes. And the cabinet members were very clear about the desire to protect other key elements of the statute that included having all 48 districts continue to report the required data elements, or see those change and continue that reporting. But then also the parental notification piece was just really something that they felt strongly about and wanted to keep in place. And then the implementation of the individual rating plans are key as well.
Notification.
Mm-hmm.
And I didn't understand the last
The
point.
reporting and the individual reading plans that are required.
Okay. Committee, we're going to hear some more public testimony and whatnot, but at the end of that, I'm going to suggest that we develop a bill draft that implements the recommendation we just heard for an exemption for the high-performing districts with a cut score in there that we can adjust, so we have something to look at for next meeting. I'm going to suggest we need to simplify this piece of legislation. The initial concept here that was enacted better than 20 years ago now, I think 23 years ago, was that we concentrate on identifying the problems, ask the district to concentrate on identifying the problems that individual students are having and how to remedy those. And I think we need to get back to concentrating on that. So I'm going to suggest we develop, and I'll volunteer to do it, develop a bill draft for us to consider next time that'll give us something to work from that people can react to, and we'll have a vehicle we can decide whether it's appropriate for the budget session or something we want to carry over the general session. But that'll give us something to work from next time. So think about that. We're going to call for other public testimony, and then we can come back and discuss that. Senator Office.
Thanks. So high-performing districts, I have a question about that, and I understand that we have different performance levels, but high-performing districts aren't necessarily the best at literacy. High-performing districts are often those that have the best demographics with parents that read to their kids, and then they pass the tests at a higher rate. Some of our best literacy experts are in low-performing districts working with more challenging populations. So I don't know how it's beneficial for us. And I guess I would ask Ms. Hamill, what is a high-performing district that the literacy group has suggested that we exempt? And why would they necessarily be better when we know that the leading indicator regrettably, for your third grade reading performance is you give me your demographics and I'll probably tell you how good you're doing.
Mr. Chairman.
And disagree with your premise.
Mr. Chairman and Senator Rothfuss, the cabinet spoke in regards to the YTOP third grade assessment scores, given that's what's embodied in the statute.
Yeah. So, Mr. Chairman, I would have concerns then with just exempting those districts that perform well, because the demographics are more important than the skill of the teachers. And you can certainly disagree with that. I don't think anyone out there is going to disagree with it. And all the time we spent on accountability over the 5 years that we worked on that made it very clear that we had to measure growth, not just the summative assessment, because the summative assessment was more an indicator of demographics than it was of performance of the school district, which is why we don't just use summative.
It looks to me like, as I look at the data, that the evidence is the other way, that the districts in Wyoming are homogeneous enough so that the differences we're seeing, people are the same roughly across Wyoming to a great extent. We're seeing differences. We do see differences based on the free and reduced lunch, but the successful districts are doing a better job with those students too. And I think that, frankly, what we're seeing with the big disparity among districts is differences in the quality of the management of the district. And the ones that are being successful, I think we need to allow them to continue to be successful. I agree with the recommendation we just got. So I think we need to develop some legislation, and then we can debate the specifics of that. And do we have the evidence to proceed to the budget session? Is it something to carry to the general session? But we've got some specific recommendations here. I'd like to see us, Mr. Chairman Northrop and committee, look at the possibility of having a bill to look at next time that implements those. Let's see if there's further testimony from others, and then come back to this issue once we've heard that. Okay, thank you very much. Anybody else here want to testify on this whole issue? Yes, ma'am, come forward. Both of you come forward, and somebody go first and somebody go second. Okay, good. Identify yourselves and proceed.
McLaughlin, I know some of you have been around here a long time, and I have been raising my grandson since he was like 20 months old. He's just turned 11, just made the traveling sports team as a pitcher, so he's very cute. It turned out that he has profound dyslexia. Okay, so I know there's a lot of encompassing information about literacy in general. We all have our ideas about what science dictates, but I'm focusing on dyslexia because it is the #1 learning disability in the entire world, in the entire country. 80 to 90% of all learning disabilities is dyslexia, and I'm sure you know that, Representative Berger. So gosh, I have so many notes, but I'm just going to speak from the heart. He was attending Saddle Ridge in kindergarten and first grade, of course, then, yes. Saddle Ridge in Cheyenne.
Okay,
I'm
that's what
in
I
Laramie
wanted.
County
Thank
School
you.
District #1. And so he attended, they suspected some, first of all, let me tell you, he's extremely bright, creative, a typical boy, but struggling in reading. So I really didn't even know what dyslexia was, okay, to be honest with you. So the first grade teacher said, wow, he's really struggling and he's so bright, we just don't know why. Fastbridge testing, 1%, 3% year after year, even during COVID, we did the online thing, but he still took the Fastbridge, wore the mask, blah, 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 had it, and so then we requested, dyslexia was never mentioned, but my husband is a researcher and he said, he might have dyslexia. So we tested him from the Neuro Center in California online. It's a 2-hour online test, high probability of dyslexia. So I thought, okay, so we started reading about it. Then we requested that he have an evaluation. So Dr. Blaney, a PhD from, he came down, wore a mask, 5-hour test. We did it in the backyard. It happened to be in October, but it was a beautiful day. His 5 or 6 page report said, okay, I think he has ADHD and I'm very concerned about the probability of dyslexia, but didn't really give him a diagnosis, processing problems, recommended 18 months later, get another neuropsych. So I give all this information to my school district. I hand deliver it to the superintendent, to the special ed teachers, to Saddle Ridge principal, who I happen to like very much. But long story short, no response. I wrote letters. I didn't bring my book, which is this thick, of all my correspondence, because I'm a get her done kind of gal, but no response. So we went back to school. And I decided to go ahead and pursue an independent evaluation in Denver. Wolf and Associates, very highly recommended. They did a 2-day eval, cost me $4,800, which I could pay, plus traveling, 20-page report, so thorough, so wonderful. Your child has profound dyslexia, dysgraphia, and probability of dyscalculia. So I took that to the district and said, we need to further develop an IEP. So in the course of this, I attended that proclamation signing of dyslexia by Governor Gordon. It was a big hurrah. You were there, everybody's yay, photo shoots. My grandson got his picture taken along with the governor. Governor was gracious. We had about a 10-minute conversation. He talked about dyslexia and his struggles, and he was great. I go to a meeting literally 6 days later, and the school psychologist tells me, well, the state of Wyoming does not recognize dyslexia. Oh, okay. Did you tell that to the governor? So I call the governor's office. I meet with 5 people. Shelley, what's her name? Lachelle, all these people, officers, blah, 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 5 people. And they said, well, the best thing to do, as short of filing due process, is call the superintendent and get a meeting. So I did. Crespo calls, blah, blah, blah. So all of a sudden, I've got 2 people from admin coming to my IEP meeting. And they said, oh, well, I guess dyslexia really exists. Yeah, it does. It's a DSM-5 recognition. So I said, let's put it on the IEP. Well, we can't put that on the IEP. We're going to put it under other health impaired reading dyslexia. No, he has dyslexia. So this is really very difficult because I love my grandson and he's suffering from anxiety and depression, slamming doors. I'm not going to school. I have a tummy ache. I'm stupid. I can't tell you what it's like. And this is a wonderfully bright, creative child. And I don't know how to help him. And I'm relying on a school district to develop an individual education plan that addresses specifically his dyslexia, and they won't put it on the IEP. So I had to get an attorney. Legal counsel cost me $10,000 to get dyslexia on his IEP, SLD, code 30045, whatever it is, and dyscalculia. And, it was just an enormously stressful situation. And I'm a pretty easy gal to get along with. I mean, let's work together, get this done. If we have a problem, how can we solve it? So just long story short, we got it done. They didn't even want to put the accommodations, like there's accommodation for kids with dyslexia that's recognized by the National Association, and also individual clinicians that work with the children. When you take a test, you have no open-ended, okay, no fill in the blank, but rather keep the same content that's required, but also just have matching and multiple choice. They refused to do it. I had to meet with a special ed, refused. Special ed teacher, you know, the regular ed teacher, unfortunately, I won't mention her name, rolled her eyes at the IEP. That is just too much work. So again, we get involved and they end up putting it on the IEP reluctantly. It was a bad experience. For the good news that came out of all this is that because I was a parent that was informed, did my research, had the money to hire an attorney, I actually got 1 hour a day, 5 days a week, and a structured literacy Wilson certified teacher to teach him. And you would not believe what that did to his self-confidence. This is like a 3 or 4 year program for someone like Jaden. But he looks forward to going to learning. He's learning how to decode some simple words, you know, and read simple things now, like little, you know, and we're going to go on to, I mean, I'm not a teacher, so I don't know how you know, explain all of the progression, but he's learning and he's feeling like I am not stupid. So he wants to go to school. And of course he plays football every day on the, you know, and so that's kind of my story. So when I hear like testimony, well, that certain districts should be excluded because they're doing so well, well, that's great if 80 or 90%, but what about the 10 to 20% who kids are not doing well? I can guarantee you they have dyslexia. So we need to really focus on, in my humble opinion, you know, as a, you know, invested person, focus on funding comprehensive system of personnel development. Let's get some brain things going on here. How can we develop, you know, I know it takes time, but some systematic way to start addressing dyslexia since it's so darn prevalent in our state. It's prevalent everywhere, but I'm talking about Cheyenne district right now, because I live here. We have, Wyoming's a great state. We have resources, we have some smart people, we have dedicated people, and all this hyperbole about numbers and percentages, you know, the bottom line is you've got a lot of kids with dyslexia. We got to start addressing it. Okay, so let's just say that for the purpose of discussion that it is something that is screened with FastBridge. I mean, that's a pretty good screener. You know, the kid has something going on. 2 years in a row, first, you know, for percentage, 3%. My God. And he's bright in every other way, dyslexia. So then, who can teach the child? Who knows Orton Gillingham, structured literacy training? How are we going to? And there's a lot of teachers who come to us and say, I wish I knew how to help that child. But they're, you know, they have to have training. There has to be investment. There has to be RFPs sent out to people to come in and train the people who are interested. Maybe a charter school to start out with. I don't know, of Chairman Scott, but I'm getting what I want for my grandson, but it's not enough because a lot of parents aren't getting the help, and those kids are just, okay.
Because you've given a classic illustration of what I've heard from a number of parents. And what this committee has been looking at, amongst other things, we've talked to some of the high-performing districts. And perhaps the most articulate of them was the Sheridan district. When they get a child that identifies with difficulty in reading, what they do is they put together a small professional team trying to figure out what's wrong with that particular child. Dyslexia tells us that there's difficulty in reading. It doesn't necessarily. There's a number of different ways to treat it. You got to figure out what works for that child, and they make that effort. The poor performing districts, I keep hearing tales exactly like yours. where the district has not been responsive. And the parents with resources take the kind of steps you have. Cheyenne, Casper, Gillette, the three biggest districts, are all below the state average. We wouldn't exempt them because we are not getting the kind of response that kids like your grandson need from those districts. And I may be I don't think I'm being unjust to any districts, but that's what we're seeing. And that's what we're trying to change with the legislation. So frankly, you've given us a classic case, and I've heard it from a number of other people that are really trying to get the best for their children and not getting the kind of response that the better managed districts are producing. So that's my response to what I just heard. Committee, any questions? Okay.
Yeah, but Chairman Scott, may I just say one thing? I just want to reiterate that there is a lot of research about what particular type of intervention works with different groups. Applied behavior analysis for autism, Orton-Gillingham structural literacy, decoding, encoding for dyslexia. It's not kind of a grab all, throw up against the wall, see what sticks. We know the research is there. And so those teachers, I would argue that even in Sheridan, if there's a dyslexic child like my grandson, they probably will not make the progress without that type of intervention.
Figure out what kind of intervention the individual student before you needs. And that's the effort that's being made in some of the districts. But it sounds like you never got that kind of treatment here, and you needed it.
Right.
He needed it.
Right. Are you going to address? Yes.
No.
Okay.
Ma'am, you haven't said anything. Do you want to?
I'm Carrie Roden. I serve, I have a lot of hats that I wear, and I have to be kind of careful with them. I am the co-founder of YLit with my probably well-known partner, Heather Fleming. She's more of the speaker than I am, but unfortunately she has fled our state because she had difficulties, and she now lives in Arizona. So now I am trying to step up and take that part. I am not as entertaining or as knowledgeable as she is, but I'm going to try my best. I'm also on the International Dyslexia Association Rocky Mountain branch. I'm on the board of directors for that. And I'm a Wilson certified dyslexia practitioner. I'm also a intensive reading interventionist in our state. I work with the lowest need kids in the district that I'm in. And I'm also a TOSA, a teacher on special assignment. So I'm trying to bring my district up with their dyslexia education. And Senator Scott, please forgive me. I in all of my education, I have an elementary degree. I taught for 12 years. I taught kindergarten, third grade, and fifth grade. I have a master's degree in reading. When my daughter was in kindergarten, I had no idea why she couldn't read. I did everything right. I read to her since she was in utero. She's a brilliant child. Now looking back, and from preschool, she had all the signs of dyslexia, and I had no idea. So again, $6,000 diagnosis later, decided to homeschool her for 2 years, which were the hardest 2 years of my entire life. But I did every single training that I possibly could on reading, especially teaching reading to dyslexic children. And now that's brought me to where I am now. All kids learn to read the same. We have decades and decades and decades of research that shows us that. And I would be so happy to share that with you. They all read the same. We have brain imaging studies. Everything shows us that. Yes, if you pour a lot of money into a higher socioeconomic group of students, your students are going to perform well. I mean, the district you're speaking of does a very good job with their MTSS system, but the program they're using does not. They would be much quicker with much less money teaching students to learn to read. And the problem with their rates, yeah, they might have 80% proficiency, but what about who's that 20%? That 20% will never learn to read on the way that they teach. I'm 150% sure. So what this law has done, able to help the amendment in 2019, help write it. And then my partner, Heather Fleming, helped write the amendment in 2021. I have seen a huge difference. It is making a difference for kids in all districts. We get calls from all districts across the state. We get calls from parents in Sheridan too, that their kids are not getting what they need, okay? It is making a difference, but the problem is the professional development. Teachers still have no idea what dyslexia is, even though we've had this law that, Senator Rothfuss brought up in 2012, right? So I had no idea about it in 2012 when I was teaching. Every teacher I asked has never knew about it. Now they're finally starting to get it. They're finally like, okay, what is dyslexia? This makes sense. I just did a training for my district on 4 2-hour sessions of understanding dyslexia and dyslexia assimilation, which I would love to do for you guys. 2 hours of your time, it will open your eyes. And SPED teachers, principals, psychologists, I had no idea. Psychologists have not been trained in dyslexia. There's teachers in there that are going through SPED training right now through the program our district offers, trying to get special education teachers. They have no idea what dyslexia is. They don't train their teachers on dyslexia, the #1 learning difference, okay? So real quickly, I'm sure you've heard some of these statistics. 70% of welfare recipients have low literacy. Children who don't read proficiently by third grade are 4 times more likely to drop out of high school. Our district totes 8 out of 10 graduates. That, in my 5th grade class, that's 4 kids. 4 of my darling kids would not graduate high school. That is just unfathomable to me in this day and age. 80% of prisoners are functionally illiterate, and 48% of them have dyslexia, which we have a federal law on that. This is the biggest one that we saw, unfortunately, come to light, and that as parents, we deal with every day with our dyslexic kids. 3 kids with learning disabilities like dyslexia, the most common learning disability, are 3 times more likely to commit suicide. There was a student in LCSD 2, a 5th grade student that struggled to read from kindergarten on, ADHD, was blamed on that. We have permission from his mom to talk about this now. He was, your child's struggling, we know he'll catch up. It's okay. It's his ADHD, he'll be fine. Finally, before this year, he had suicidal thoughts and tendencies and was hospitalized. They went into the school year with plans in place. Parents had a plan, school had a plan. They hired a tutor and an advocate. He was finally diagnosed with an SLD in reading and the 3rd percentile of kids, 5th grade. Okay, think about all the trauma this kid has gone through. 5th grade, every day knowing that he is less than, he feels less than because he can't do what everyone else next to him can do. On January 9th, he was supposed to start his special education class. He didn't want to because that's where all the dumb kids go. That's where all the weird kids go. I don't want to go to that class. I'm a 5th grader. I'm a 5th grade sensitive kid. I don't want to be that kid. Well, the day, January 9th, that he was supposed to start, they found him hanging in the bathroom by his sweatshirt, and he unfortunately passed away. As a parent of a child who has told me numerous times that she wants to die, she's going into 7th grade, and I work in the district that she's in, and I have had to fight tooth and nail to get her what she needs, and she still doesn't get it, and it's not, I'm not blaming teachers. I was one of them. I did all the horrible things that I look back on, and I make sure and I tell in trainings, I made kids sit against the wall at recess and read. I did horrible things because I had no knowledge. But the problem is that teachers still don't have knowledge. That's the problem with this law, is it's not being enforced. We have a good law in place, but we need our state to step up, and we need them to say, these are the programs that are approved by people that know how reading works in the brain. These are the screeners that work for kids, and this is what you do. This is how you help these kids. The 80%, excuse my French, is BS. We can have 100% of kids learning to read. We can, if we just teach them the correct way. And I would be, like I said, please, I would be happy if you were willing to give 2 hours of your time. I will travel to where you are and do a 2-hour dyslexia presentation and assimilation for you, so you can just have a minute sense of what these kids suffer every day. Every student that I have, my own daughter, her grandson, these districts are trying, but they need direction from our state. They need direction from you guys to say, it's okay to make a list of approved programs. It's not controlling. There's a list you can choose from. Reading recovery is not one of them. It is not proven to work on reading. So, but we need you guys to say that that's okay, that we can do that. We can have a list of approved screeners that screen for the correct measures in kids, approved trainings for teachers that teach teachers how to teach reading correctly and how to intervene when it's not happening. Okay.
We had an experience here 2 years ago.
Okay.
Your predecessor, Heather,
Mhm.
brought to us a Dr.
Yes.
Prue
Yes.
from
Mhm. It's amazing.
Yale University of
Mhm.
Connecticut, who'd been doing fMRI research.
Mhm.
That was very enlightening.
Yes.
And one of the things that he said was that when people are learning how to read, that, all of us use the same, his fMRI research was showing all of us use the same brain areas for speech and language. What he said was they had discovered that 70% of us use those same areas for reading, 30% use other brain areas. And the
They're not-
implication of that was that you have to, when you have a child that has problems with reading, has dyslexia, you have to figure out what works for that child. And there are things that work and things that don't work, and that depending on how they learn how to read, they may need certain different things. And you also have the problem of uncovering problems that are independent of that kind of thing. Vision, hearing, you always have to look at that as a possibility. And there's some other things like that, but those are the two big ones. So you do have to concentrate, I think, on figuring out what the particular child before you needs and getting an intervention that works. And these one-size-fits-all interventions may help some, but not many.
May I reply?
Is that, am I making sense to you?
You're making sense. You have pieces that are correct. You're right. So, 20 to 30% of kids are reading on the right side of their brain. There's other brain, that are differences too. The thing is that they have proven with no doubt is the efficient way to read is on the left side of the brain. There's 3 parts here that do it. And so we know that students who read in different parts are not reading well. And so they have proven this through these fMRIs, in order to get kids to read proficiently, word read proficiently, you have to intensively, explicitly, multimodally, I don't know if that's a word, but multisensory is the old term, teach these kids to read. And every student learns to read the same. Every single student. And you will hear this from every reading researcher that has based their research off the science of reading. There's no different way to learn to read. The majority of kids that struggle to read struggle with word reading difficulty, the majority of kids. And I know Dr. Hugh would agree with me 100%. And in order to teach these kids that have a word reading disability, you have to teach them the structure of our language in a very explicit manner it takes a while, especially the older the kids are. It's going to take longer for them to become proficient readers, but you still can. If you're teaching them to the 3 cueing system, to look at the picture and guess the words, that's what poor readers do. That's what they have found, that actually through brain imaging, poor readers read that way. And that's the way that I was taught to teach reading. I was taught to look at the picture, just look at the first sound, guess that word. And that's what reading recovery does. They still follow that same model. And it has been proven, if you listen to Emily Hanford, she is an amazing, she has delved deep into this. There's a lot of push against that. But what I'm telling you is that everybody learns to read the same. Some child may come with a lack of vocabulary and background knowledge. Well, that's different than a word reading disability. But we know that only 10 to 15% of kids struggle with their oral language. that the majority of kids have a word reading difficulty, and there is only one way to fix that.
Thank you, Mr. Chairman, and thank you for bringing your expertise. And one of the concerns you're raising is reliance on reading recovery, but I don't think the connection has been explicit. Your concern is that Sheridan 2, which is one of the top performing districts in the state, relies on reading recovery, and what you're doing is specifically indicting that. So as we contemplate the idea that our highest performing districts in the state should be exempt, your testimony is in fact that they're using the least qualified system that is available in the marketplace, and that perhaps they shouldn't be exempted. Is that a fair assessment?
Yes.
Thank you.
Senator Brown.
Thank you. I kind of want to go back to, I know just the reading in that every child reads the same. And I think Orton Gillingham was mentioned earlier, and it's somebody that I've heard of. I have a son who I did not think would be reading well by the end of first grade. In his school, they use I don't know what curriculum, but I know it was developed for kids with dyslexia. And he was reading beyond what I thought he would be, first or second grade. So I personally am a fan of this idea that we teach all kids to read the same way we would dyslexia. And in fact, was recently talking with a mom who had, she's got a degree in like neuroscience and research and does reading and stuff like that. And she was telling me that she had a son that wasn't diagnosed with dyslexia until high school because she used a curriculum developed for kids with dyslexia. Never discovered that until high school. I guess not so much a question, but just can you kind of comment a little bit on that and maybe more how it is that we're seeing? Because I think you are from my experience and what I'm seeing, if we taught all kids to read like kids with dyslexia were taught to read, that we would have like all our kids would be proficient.
Exactly. And so, yeah, it's Orton Gillingham is kind of the old way of saying it, that it was developed in the 1930s. And so we have known for almost 100 years how dyslexics learn to read for 100 years, but it hasn't reached teachers. But what they've discovered through that is getting, more, especially in the Google area, right? Moms Google and what's going on, and dyslexia comes up. We have learned that all kids learn to read best that way. And so now they've changed the terminology. The IDA is structured literacy, and it encompasses all parts of reading. It's not just word reading. It encompasses fluency and background knowledge and comprehension, and vocabulary. But we do know that kids need a very rich oral language background. They need to be read to. They need to have good vocabulary, but all kids learn to read the same. My 7th grader dyslexic and my very high performing 4th grader learn to read the same, but my high performing 4th grader, she can learn quicker and more if she's taught in a structured literacy way. She didn't know when to use TCH and DGE, as a really high reader, but through structured literacy, she's learning how to do that. Through the programs that our district uses, she's learning how to do that. And so all kids learn to read the same at a different pace. And so that's the biggest thing, is they learn to read at a different pace and a different intensity. Some kids, tier 1, right? They learn it right away. Some kids, tier 2, they need a 30, 40-minute intervention. Some kids, tier 3, they need an hour plus a day, every single day for years. But guess what? We can exit them out of special education. We don't have to pay that, $18,000 a year to keep them in special ed. We can get them to read proficiently and exit them out.
Oops. Thank you, Mr. Chairman. And as you look at this classroom size, do you think there's a correlation? Do you like, are we all right with 16, or do you think it's okay with 20, 25, 30 kids, so that we can get, what helps with this intense reading process?
I know that studies show, which is, as a former elementary teacher, show that class size has no effect. It's the teacher knowledge is the number one effect on kids. But as a teacher, as my, before, oh my gosh, yes, class size, because you can dial down to those individual needs with the smaller class sizes. There's no doubt about that. But again, if the teacher doesn't have the knowledge, doesn't matter. It doesn't matter, right? And so we need to make sure that our teachers, number one, anything that you get out of what I'm saying is our teachers need to be trained. They need help. I mean, we are leaving them high and dry. I work at the best school and I have the best principal, and we had 2 of our best teachers leave this last year because they're burnt out and they're young and they're amazing teachers, but they're done. And so what you're saying, you're taking time on this retention. It's real. I saw it this year. And class size is, and one of them had a class of almost 30 in 5th grade, and that it's hard.
Thanks, Mr. Chairman. What are they burnt out on? I know, and I have that experience.
Well,
what are they burnt out on in your area?
Just
These high-performing teachers.
Yeah, the needs. They're spread so thin. Everything that they need to do, in my mind, our number one goal is to teach kids to read. If we do nothing else in our education system, every single child should learn to read proficiently. Definitely by the time they graduate, right? They should learn to read by 3rd grade. But yeah, their burnout, I think just and I can't speak for them. I haven't been a classroom teacher forever, but knowing what they're going through, I would never go back to the classroom ever. I love my tutoring. I love working with small groups. I would never, because everything that's laid upon them, it wouldn't happen.
Yeah, thank you, Mr. Chairman. I want to thank you guys both for being here. I'm a mom who's had a similar experience years and years ago in Texas, and discovered that my daughter was not reading in the 1st grade well, and conceptually she was beyond the class and understanding concepts, but she could not read. But it was in Texas, but they did not test until like 5th grade at that time, and so I had her privately tested. I actually found a tutor, one with a master's degree in reading, who had focused on and specialized in dyslexia. I discovered that I had mild dyslexia that I never knew, and I learned my own coping mechanisms. And again, the tutor also then taught me how to work with her. And by 2nd grade, we had begun to bring her to that place. So early intervention really does help. And I really appreciate you emphasizing this. But I did have one question that veers off a little bit from reading, because I think there's a connection between dyslexia and mathematics, because actually that's probably where I struggled more in some ways, and my daughter as well. So it's a beyond reading issue in our education system.
Well, sorry, Chairman, I'm not good at these formalities quite yet, but I will get better. There's studies that show that math facts are stored in the same place of the brain that sight words are. And so if you struggle with math facts, you're going to struggle with every part of math, right? Even if you understand the concepts, you can't, it's hard for you to do it. So yes, there's a good correlation between that.
Committee, we do have a time from somebody.
Yeah. Mr. Chairman, I appreciate that we've got a time crunch, but I'm going to just blatantly say we spent 6.5 hours yesterday on information that wasn't even in our purview, and this is in our purview. And so I think that we should be giving our due diligence and our due time, not only to these witnesses, but everybody else. So, Mr. Chairman, I can reserve a few of these comments for the end. My question directly is, number one, thank you for stepping up and helping out with Heather not being here. My question is, and it's to the 2 of you who have been in this school district, but also to a parent who has been around here. We've heard we don't need to necessarily affect the statute right now. What can we do as a legislature to aid the system at the local school district level? Because what I'm seeing and what I'm hearing is these kids that fall through the cracks, and those are the ones that we're missing out on. And those are the ones that every so often we'll find one parent that has that type of money to go spend $5,000 on an independent assessment. There's a lot of those parents that don't have that. And there's a lot of those parents that they're just not even being, brought into this. That was why it was such a crucial piece of last year's legislation to get this in there, that we had the parent notification and that parent is notified. if you guys are still experiencing this, now I don't know if you guys are still experiencing this, how long ago your situation was with Laramie County 1, but what can we do at a legislative level that aids the impact of what we are trying to do? If we don't change anything else in the statute right now and we say we're just screening, that's all we're trying to do. And once we get that kid diagnosed and that kid is on our radar, how do we help you guys make sure that these school districts hear from the parents?
You want to go first or? Me go? Okay. Well, first thing I want to say is that this isn't just an LCSD 1. I mean, like I said, LCSD 1 is doing everything. They're working really, really hard. They are. And so they're really trying to follow this, but they're waiting from guidance from our state, right? And so that's what everybody's been kind of held up. Like, well, we don't want to start something if the state is going to recommend something else. And so it's just been waiting and waiting. Well, now the state's not going to really, I mean, they recommend PD, but they're just like PD, I mean, and what? And so we need to be more explicit in the type of training that teachers are getting. You need to hear from professionals that in the science of reading, structure, literacy, that is the evidence-based, because unfortunately you can say anything is evidence-based, right? And it's not, there's things that are not evidence-based that are being used. And so for the district, if we are screening our children as the law states, there shouldn't be kids now falling through the cracks, where before we weren't, right? I think this screening just really started getting robust this last year, and kids are really, at least from what I'm seeing, really getting caught, in the net, right? But they get caught in the net, and the problem is now is like, what do we do? And that's the thing, and that's where the teachers are struggling with. And they need the education, they need the training, and that is teacher training is number one.
Chairman, my question goes right to that. Teacher training, so they're not getting this at the university, I'm guessing. And so this has been on our radar since I've been on the committee, and the university keeps saying they're going to do something about it, and I don't think it's being done, is it?
Mm-mm.
Are there other universities that are teaching training teachers in this? Which ones are they, and who can we learn from?
Well, there are great universities. If you go to the International Dyslexia Association website, they have accredited colleges. And what they're seeing at these colleges their numbers are shooting up of people wanting degrees from them. I mean, because they know this is the place where I'm going to learn to teach kids to read. Kids that are just graduating this last year, or kids, I guess, young adults who are just graduating this last year from University of Wyoming, they don't use the word dyslexia, and so I'm like, it's like a not dirty word, and I don't get it. I think it gives so much power, and we can't diagnose as teachers. We can say your child has signs and symptoms, and so it gives that word, right? Hopefully, maybe someday we can, because there's no reason why school psychologists shouldn't be able to diagnose it. But if it's a state law, that has to be changed. But again, it goes down to teacher training. I mean, we just need to get teachers trained and get licensure changed. I think that would be a good push. But again, it's not only UW, Western Governors College. I speak to teachers that have just finished their program in special education, didn't learn about dyslexia. The number one learning disability, so 8 to 9 out of 10 kids are going to be dyslexic. And they're still not learning. And so it comes down to the districts and the states to have to pay for that.
This off at this point, we're going to come back to this topic but we've got in the next presenter, we've got somebody who can't be with us after a while. So we thank you very much. I hope you can stick around, because we will come back this probably right after lunch.
Okay.
We do have to move to the next presenter, because they cannot be with us.
Thank you. Thank you very much.
We very much appreciate the testimony you've given us. Okay, committee, we're going to take in a 10-minute break, come back, and then we're going to hear from the early childhood people, and then we will come back to this probably right after lunch. Okay, we're in recess. We're going to come back to the K3 reading after lunch. We're going to now deal with the early childhood education. Shelley, y'all are on. Introduce yourselves and proceed.
Thank you, Mr. Chairman. Shelley Duncan, representing Wonder School, and my colleague here is Christina Miller. Before she gets started with the presentation, this is really loud, sorry. Wonder School has a software system and education management program to help providers with emphasis on rural care. They provide the state and parents transparency and data that works to compare either childcare providers and or K-12 schools. They're working on getting accepted in RFI for the Department of Education in Florida to track and give access to data for parents in their school of choice programs. Other states, they've increased economic development with creating new providers utilizing their programs. They have multiple successes in increasing childcare providers in other states, thereby closing the childcare gap Wyoming is currently experiencing. Today, we are here to present their program and enlighten the committee to the potential progress we could make with Wonder School's assistance. And here is Christina Miller from Wonder School, and she's here to present and answer any of your potential questions.
Introduce yourself. Co-chair committee, my name is Christina Miller. I come to you with over 30 years in education in both school district and in the ed tech space, and I'm very honored and privileged to be here today to present before you on this very critical conversation about how to build and create childcare infrastructure in Wyoming. I asked Mr. Chair if we could look through the lens of understanding the data around brain development, and it turns out that 90% of brain growth actually occurs before a child enters kindergarten. So it's really critical that when we talk about the early educators whom we're talking about today, that they're equipping them with that lens, because they are the ones who are shaping and influencing the milestones and the critical developmental key critical things that are happening for children to achieve those successful outcomes from cradle to career. So with that lens, we'll go ahead and kick off. What I'd like to do is give a brief background on Wonder School, just understanding who we are and our mission, and then really take a deeper dive from that national landscape and then funnel it down into what's happening in Wyoming and how we're working closely with the state and all the work that they are doing in this field. And so from there, I'd like to talk through how we actually build family childcare from scratch, and then how we support existing providers who we built sustainable programs through automating and invoicing and really helping them move from a paper-based to a technology world. And then a part of that solution is really thinking through the childcare portal and the childcare coordinated enrollment. Many of the topics and conversations that we've been having in these sessions are really critical to the success of that. And I'd like to be able to demo and address any questions and answers. So Wonder School started back in 2016 with the mission to support and stabilize these providers who are doing the workforce. They are basically the workforce behind the workforce. And one of the key differentiators in the space is that we're actually creating this new family childcare from scratch. And so what that looks like in Wyoming is that we're actually starting family childcare with these small business, independent business owners who are starting with 10 or 15 children. And the really unique piece about this is that we can tailor those needs around all kinds of provider programs, looking at like manufacturing, 24-hour care, extended hour care, those workers who are non-exempt. So that's one of the key pieces. And what you'll see here is this is Chris Bennett. He's our CEO and co-founder, featured with his family childcare provider. So really our mission is to equip providers, give them the business integrated tools that will help them be successful, and engage them with families to find high quality childcare. So what does that look like in Wyoming? Well, across the nation and in Wyoming, the the number one issue is capacity building. How do we create new childcare seats? So that is the issue. We're talking about childcare deserts, and parents have a lack of choice. So number one thing is to train providers and level them up and give them access to integrated business tools that will help them sustain their business. Now, it turns out that Wonder School solutions are aligned to the Western Governors Association's goals as outlined in one of the 6 policy resolutions for rural development that was reported and committed to by the governors for 2023 through 2026. And it turns out that childcare is listed on page 4, number 16, multiple times as being a very integral part of one of the needs in the state. I'm going to step back just briefly and look at the national landscape for this area. If you're familiar with Bipartisan Policy Center, Linda K. Smith is a Child Care Initiative Director, and she recently spoke at the Western Prosperity Roundtable in Bozeman, Montana. And she was a facilitator, and there was the first panel to go up was on childcare. And one of the integral pieces here is that family childcare makes up the lion's share of programs across the nation. And so this is no small business. We're talking about a $60 billion industry that employs approximately 2 million workers. The other misnomer I want to clarify is that 52% of these providers actually have an AA degree or higher and aspire to continue their education and get professional development. But let's face it, many of them lack the time, they don't have health benefits or time off, and all of these other issues around this. So it's really helpful to understand this lens. Also, we work closely with Louise Stoney and Opportunities Exchange. And if you haven't heard of them, they really promote this idea of the secret ingredient to a successful program is really about leveling up and leveraging technology. And I applaud Wyoming for their recent RFP on how to build a robust system or program to integrate all the disparate systems that are happening in the early childcare system, whether that's through the licensing, childcare eligibility, subsidy, you name it. There's so many data pieces that all need to talk together, including quality. So the premise here is the iron triangle. It's the early childhood education understanding of finances. It's the 3 T tenets, for capturing full enrollment, making sure that providers are covering their costs per child and setting their market rates appropriately, and that they are collecting full fee. So again, going back to that idea of moving from paper-based to electronic systems to automate invoices, enrollment, and communication engagement with parents. It turns out that during COVID, approximately 40% of programs closed across the nation. And with Wonder School, only 3%, because we actually have iron triangle dashboards where providers can log into their dashboard and really understand their nets, profits, losses. So what does that look like? We've adopted this tenet, and I've taken the liberty of looking at a program starting conservatively with 10 children. That would be family childcare. Another conservative number is the monthly tuition, approximately $751. Now keep in mind, this does not include quality. When we increase quality, the tuition rates go up, and that includes the number for infants and toddlers. So I'm kind of separating and parsing that out so we can see what it looks like when a provider is using and really utilizing well childcare management software as opposed to not using it. And this again is back to the iron triangle tenet of the secret ingredient to build sustainable businesses, and why only 3% of Wonder School programs closed during COVID, because they can be agile, they can pivot, and they can really start to think about where that money is coming in from. So in Wyoming, that looks like about a 78% increase. I've seen in other states that I work in that we can even get up to 95%. Yes, Mr. Chair. Again?
You've lost at least me on the curve. What are you talking about?
We're talking, percentage of childcares that closed, sir. Good, thank you for clarifying that.
So now I want to turn our attention to the parents. So Bipartisan Policy Center has done multiple surveys, and they did a survey back in December 2022 of employed parents. And what they found is that 52% of parents were having to make sacrifices about whether taking a job, quitting a job, or altering hours. So the drivers around this really tie back to the economic component. And the other piece that I want to call out is that monthly childcare expenses, especially if we're coupling with multiple children or infants and toddlers, equal to the cost of mortgage or rent. This is causing a huge burden on families. I've also linked to the Laramie Boomerang article that highlights after COVID, 47% rate increase on tuition for monthly childcare expenses. So please feel free to look at that with your electronic version, and you can check it out on your own. So now, working with the state, Bipartisan Policy Center did an analysis. They actually worked initially with 35 states, and now we're up to 41, where they've looked at the childcare gap data in each state. And they even drill it down to cities, counties, opportunity zones. And what you're seeing here is this census tract analysis and looking at children under 6 with parents in the labor force, whether that's one or both. And the distance methodology is 5 miles for your urban and 12 for your rural. So I think the data speaks for itself that this is really impacting our rural communities. And that's where Wonder School actually can come in, because we have our most success with our rural communities. They also did the survey with rural parents. And what you'll see here is that 86% are making a decision to stay home, and that childcare responsibility influenced their decision in some way to not return to the workforce. Also, top of mind for all parents is safety, trust, and cost. I think we can all agree on that. So I want to really drill into the study that was done in the collaboration with the state with Bipartisan Policy Center. Linked here is the summary report that really gets into this nuts and bolts. But I think the takeaway for us here, and we're going to look at the iteration of the refresh data in just a moment, but what you can see is the percent gap during 2020 was 27.6%, which equates to 0.3 to 0.5 of a billion over the 10-year forecast trajectory of the loss of income. After the refresh, it appears that the data is more improved. We can see that it's dropped to 21.3%. But after conversations in the state, it turns out that this is due to attrition of families leaving the state. So this is a big concern. We really need to think about how can we support this. And so now we've dropped down to about 250,000 on that long term. Now notice that I've called out that it's 2019 through 2028. So that means that we're 5 years through this projected forecast of losing this annual income. And you can see that what our current supply is in the state. And where Wonder School really steps in is the Family Child Care Center and the Family Child Care Home. Yes, we are working on solutions around substitute pools for early child care classrooms and centers, which are sitting empty, and many are closing because they can't recruit. K through 12 has a similar issue with recruiting and retention. Same scenario here. So we are working on solutions around that, but we really like to stick to where we started out back in 2016. Now, the key component here is when we partner with the states, we can actually tailor to thinking about recruiting providers who are interested in supporting 24-hour care, like the evening care, extended hours, like I mentioned earlier. So you're probably wondering, what does that economic impact tie back to? So it's the 3 buckets of household impact, business impact, and state tax revenues. So it's clear here that this is happening from the parents leaving the workforce or not able to come back to full-time, or single parents having to give up or sacrifice, having to rely on friends in the neighborhood who maybe the child is not receiving the most quality care, they're just getting by. And then also with business impacts, turnover, retention, absentee, rehiring, retraining, all of those components. Then you couple that with the tax revenue loss. So that's how these numbers are derived. Now, again, Bipartisan Policy Center has analyzed by county. And this is what they're equating to on the low and the high estimate. I've taken the average of what it would take for the community to have 1 child care seat basically that dollar amount of like what is returned to the community when one childcare seat is gained. And you can see the data speaks for itself here as well. And you can see which counties are most impacted. So we're talking Campbell and Sweetwater is the highest economic impact currently. Now, I've kind of spoken to this already, but I just wanted to clarify. So what does that holistic childcare infrastructure look like? So again, we create new family childcare providers. We stabilize those existing providers with giving them the business tools, taking that passion that they have for kids and turning it into addressing the business acumen of that side of the house. And then we connect and engage parents with the resources that they need in order to find quality childcare. And then the beautiful part is that through these different systems, we're able to pull back-end data and customize filters that will help drive decision-making in the state. And we've done this in multiple states, which I'll share in just a moment. But here's our six-step methodology on how we do this. And again, it's about the recruitment. It's about finding passionate people, maybe moms that are wanting to stay home with their own kids, but yet have an income and give back to the community. And then we help them through their licensing. And then from there, we support them with professional development, business coaching, handholding, and then get them trained up on the software and helping them get devices or hotspot, addressing any broadband issues in the state. So we've curated all 50 states on the licensing, and we've identified, we work with the licensing department directly to remove any barriers and understand what are the issues that could be preventing these programs from launching. Then the providers go through their Wonder School Academy, which is a self-paced 12-week course, and then we help them transform and launch their programs. They write their business plans, they identify how they're going to market themselves. Are they going to be faith-based, Montessori, play-based? We help them with that. But these are small independent businesses who are making their own decisions. And then we support those existing providers by moving them from paper to technology, helping them integrate with the future data systems that are coming down the pipe in each state, not just Wyoming. Now, the other piece I want to call out is that all of our software, whether it's public facing or the back end, is converts to and translates into Spanish. So it's really critical that you understand this is not Google Translate. These are in-house team of experts who are translating this for the providers. And 30% of our providers are actually ESL. They have another language. So we definitely accommodate for that. I'd like to take the liberty of hopping into a case study. We have a partnership with New Mexico, a state partnership with them. They have adopted our Childcare Finder, and one of their providers is Joellen Bennington, and she's a rural provider who has, it's just outside of Albuquerque, and let's see if this loads here. And I'm hoping that the audio will go good, so let's just keep fingers crossed. And let's see if this works.
We feed the animals outside. Yeah. We water the garden. We have music time. Yeah.
Because that.
Feed the animals outside. We do our chores. And we water the garden. And we do crafts. And we have science. We have music time and playing and running elements. I start at 6:30. We feed the animals outside. We do our chores. And we water the garden. And we do crafts. And we have science. We have music time and playing and running and turning brown in the summer. Wonder School is a very good resource. And they've built an incredible software program for us to use that is very user-friendly. I really like the child care management software. It helps me keep all of the children's information organized. It manages my finances, its marketing. As soon as I had the information in and it built my webpage with my pictures and my philosophy and all of those pieces, I started getting calls right away. And I really liked that. Once I had built the website, that I didn't have to do any more work for marketing. It just comes to me. It is a great communication tool between me and the parents. Before a prospective parent comes to see me, they're seeing pictures of my daycare. They are seeing everything on the website, so there's no surprise when they walk in. I want my families to feel comfortable here. I want good fits.
Okay. Let's. Oh, there we go. There you go. Okay. Okay. Back to that. Okay, so just moving that out of the way, I just wanted to show you Joellen's website that she's created, how she engages with parents. Parents can apply directly, they can message their director in real time, they get an app. And this is the New Mexico portal, so you'll see that as well. Wonderful piece about that is there's all kinds of filters on availability, quality ratings, scholarships, if the provider accepts them or not, they can filter by that. And then just an example of some of the back-end data, we can actually drill in and understand what's happening and where are the parents searching by county and by zip code. So we know what ages and ranges they're looking for. And I'll just go through this quickly just to make sure we have any questions, but that's an example of the data. Here's our state partnership with Nevada, some of the case study that we've done there. We've actually created 370 programs in our partnership over 17 months. And we're doing some great work there, as you can see in your handout. And then we also have partnerships in Michigan, like I mentioned, New Mexico, Indiana, Mississippi. So the list goes on. And then last but not least, I just wanted to wrap up by sharing in partnership with Deloitte, this is what the portal looks like for their student choice portal. And we are in the runnings for that, and we're awaiting the award any day now to satisfy that need for their ESSA ratings and their engagement. Mr. Chair, did you have a question?
Yeah. Basically, let's focus in, because this is the Education Committee. The committee that deals with the availability of childcare is the Labor, Health, and Social Services Committee. What I'm hearing your message is that it's important that the childcare providers have a business model that works and that they can manage and make a profit at. Otherwise, they can't provide. What I want to do is focus in on our interests, which are in having some early childhood education provided in the childcare setting. And how do we go about getting that done? What I hear you saying is the economics are important and we have to pay attention to that. I will pose two questions for you in the education area, and then we're going to throw it open to the whole committee. We heard a bill yesterday on education savings account that proposed to give essentially accounts to individuals in the poverty levels, and they, with a means test, to purchase early childhood education. If that is that feasible as an add-on to what your providers are doing, and what kind of fees are they likely to need to be able to deliver? And educationally relevant program, which probably vocabulary expansion and that sort of thing, as part of the childcare? What level of resources, what level of tuition are they going to need from the parents? That's one question, and then I'll have another one on timing and availability. So any response on the, well, let me ask the other question too. When we did the welfare reform, this state had one of the best in the country. We got rid of 95% of the AFDC roles, and we just don't have them on the TANF anymore. We thought we would have to expand childcare to accommodate that. We did and couldn't spend the money. And the reason was that the childcare providers were available, focused on the normal business day. The people on welfare coming off were catching jobs that were not in the normal business day. They were the third shift in the convenience stores and things like that. And they were having to go to family and friends for their childcare. So you weren't being seen because it simply wasn't available at the times they need. Is there a solution to that? So those are the two questions I'll pose to you, because our interest is in getting the educational part of this done.
Yes, so thank you, Mr. Chair, for those questions. First off, when I think about how we're supporting the providers, it's a 2-year commitment. It's a one-time fee. And that is a direct implementation with whomever the sponsor is. So I work with cities, counties, and states. I have a Dallas County pilot right now. We're building out new supply, very successful. We have 10 providers that we've created in their vulnerable districts and school areas. And one of the things that we're doing now is we're doubling that. We actually have completed that pilot. Now we're doubling that. So when Nevada, that's a different beast because we're talking about a statewide deal. And so again, these are providers who are independent small business owners, and they are making their own decisions about how they want to run their programs, how they market themselves, what curriculum they have. Some states have curriculum that is chosen for them. They have options, like maybe 3 or 4 choices. But the bottom line here, I think, is that I want to make sure I'm answering your question. I want to make sure I understood your question. Did that address it?
Yeah.
Okay.
How much are providers going to need to charge?
Oh, the market rates?
Yeah,
Okay.
in order to provide
Thank you for
the
clarifying, Mr.
early education things that we're interested in. Because it's obviously they've got to make a profit.
They've got to make a profit. Yes, sir. So I gave an estimate in my presentation, apologize if you missed it, was about $751 per month for an average price that was not truly designated as high quality. The Center for American Progress has outlined all the states and identified the ages and ranges of the approximate cost, and it's mapped it to quality as well. So
The total childcare or just for the educational portion?
that's for the monthly tuition rate for the childcare, for what the provider would receive. Yes, sir.
Okay, just for the childcare.
Correct.
Okay, we're interested in adding to just to the childcare, the education piece. What's that going to cost?
That could be inclusive. That could be inclusive.
Makes sense. Mr. Chairman, so you would have different providers. And so those that we're talking about, that you're talking about, is more of a pre-K. So the pre-K, currently, we don't have any licensure requirements for you to be called pre-K. That's kind of a problem, I think, personally. However, some of the providers that I witnessed in Nevada, they had this program to where it offered a teacher's lounge, it offered a resource lounge and shareable lounge, so that these providers could go in, and that's the second tier to Wonder School. They do the business model, but they also do the education and training so that those providers can offer exactly what you're talking about. They go in, they have resources, they have handholding for 2 years, they get training. They also are encouraged to go and try and create this business model so that they have their own schedule, they have their own, an increased income so that they could go and get their further education, to get an early childhood education degree and have that extra part. Did that help?
Committee, any questions? Chairman Norton.
Thank you, Mr. Chairman. So 751 a month, how many hours a day and how many days a week does that cover? Is that 5 days a week?
Oops. Sorry about that. Mr. Chair, that's typically about 5 days a week. And that's just an average, like if a working parent. So I'm looking at the hours of what a working parent would need.
Okay, 8 to 9 hours a day?
Correct.
And Mr. Chairman, there has been some dialogue with us, with Wonder School from the Campbell County area of different mining areas and different businesses interested in trying to provide that 24-hour care, that overnight care for the mining and railroad. And then, of course, we have our military, that they often have an issue. And one of our own senators brought to attention to it in a different meeting I was in about the fact that, sometimes legislators, they need to be gone for days, and overnight. And it's very difficult to find quality care of someone who can step in for that parent as a legislator when you're in session or when you're in the interim. So there's a lot of different models. And the fact that these guys provide support and education to help those people who are willing to do that non-traditional type of care and education.
And we're looking about doing partnerships actually with school districts. The really interesting thing in Wyoming is that family childcare can be in the home and it can also be in a building like a church or a school building. And so I'm having conversations with superintendents across the state who are saying, my staff need childcare. And so this is really a creative community-based solution on how to address that. And it turns out that most families really do want their child in a small group setting when they're very young. Centers are wonderful, they have their place, but parents really like the fact that they are a mixed age delivery system. And so this is interesting because when we can tailor each implementation to the unique needs of that region, whether that's a hospital, that's the other piece I didn't get to share, is that we do partner with employers as well. And we can do a hybrid approach, like a concierge service where we're actually helping find parents, taking that lift off of them to help find that childcare, or if there's not enough childcare, creating it, helping with the sponsorship piece and managing that back end data on the invoicing for the scholarships.
Thank you, Mr. Chairman. We changed some of our statute in the last session to essentially allow for more in-home childcare, not facilities, but home care. So I think what we did was it's like 8 to 10, it's 8 minors who are all over the age of 36 months old, so forth. So expanding our ability to have more home-based childcare. Is that something that would fit in this? Because under our state statute, they're not regulated at all. And so how does that work with this sort of system and ensuring quality for, I guess, consumers or for parents?
Mm-hmm. Yes, so we work with those providers to help understand quality, help them support with their professional development. We align it with the state, so there's a current curriculum and quality component that's happening already. So we partner with the Department of Family Services, the entities, the local grassroots organizations that are working to improve quality.
Thank you, Mr. Chairman. So in these cases, they wouldn't be under Department of Family Services and they wouldn't be working with any government entity. They'd be solely private. And so I'm curious if, and maybe Ms. Duncan knows what I'm talking about.
Yes. Thanks, Mr. Chairman. Representative Provenza. So one of the things that's really great about the system is that you can import all of the providers throughout the state, whether they are subsidized, whether they are not, whether they're a center or whatever. And then you can have like, the example is like that I was told is like an Airbnb experience. You go in, you can see rating that maybe they have this education, degree or such. Maybe they have, this extra education, or maybe they don't. And maybe they have, these different extras. And so you can go in and actually see on this dashboard of all the different possibilities in there. So then you can pick and choose. So whether you are one that falls under a licensure situation or not is irrelevant. You could still be in this overall dashboard portal and see all their credentials or lack of. Does that help?
I think along the same vein that really would help me understand is that you use the term partner with states, partner with cities, or partner with businesses. I need a better picture of what that really means when to partner with. What's the agreement? What do you provide? What do they give in favor of that? Because I'm not really sure I have a good concept of that.
So, for example, Mr. Chair and committee, what that looks like is the sponsorship, whether that's at the city, county, or state, actually financial backing. And then we find an implementator who is local. And in the case of Nevada, that's the Las Vegas Urban League. Among the Department of Welfare and Support Services actually is the financial backer, and they do the implementation, and we partner with them. We've built a coalition. Now we have the business chamber supporting this work. We have multiple entities who really know the space and know the providers. And so we work with them and we collaborate, and we all bring our strengths. So everyone is working in unison together rather than, working separately. So that's the really unique piece about the work that we do. And so this is a question I get a lot because it's so unique and so different, and each implementation is customized to what is happening locally and regionally. So I hope I've answered your question, but think of it as a financial sponsor and then an implementation team who we partner with, and we help support the providers through this process to create this business. And we do it like Ms. Duncan said, we stay with them for 2 years and really ensure that they are equipped, get a few tax years under their belt, and just make sure that they understand how to run a successful and sustainable business.
Mr. Chair and Representative Lawley, one of the things is the way to look at it is a public-private partnership. So they are the private part, and we also have sometimes in some of the states, you have like the Urban League, you have different charitable or nonprofits who will partner with the state. So the state may do, in some cases, some of the states may do the actual, a little bit of a financial investment to help do something statewide so that they can gather data, they can do all this. But the other partner, the public, the private part that may be nonprofit or even or a profit, they partner with them too to help some of the implementation and maintain the portal throughout the whole state. So as far as the state's concerned, in this kind of a scenario, we're just providing the education for you guys to know that it's out there, because we are going to address potentially the skilled nursing facilities that are really, really lacking employment because they don't have the childcare. And so this would be like, for example, the state would help maybe a pilot program by helping with the financial part, with then turning around, helping the state fill the workforce and help by providing the childcare.
And let's try to focus on the educational aspect. We are Committee 10.
Well, my part is, I guess, question that there are some, what would you do for the current providers that are providing really good education? I mean, they have certified teachers in those pre-K groups that are certified. They're working on literacy programs. They're providing really good information to kids, to the school districts when the kids come into kindergarten. So where are you going to help with those current ones that are doing that. Is that okay?
Mr. Chair, where we come in is we help them improve whatever, we help improve their existing system. So going back to the Iron Triangle, improving their salaries. These providers are living on razor thin margins. They're barely surviving. And now we're coming up on the end of stabilization grants. So there's a lot of concern right now. So they are literally living paycheck to paycheck. And so that's where we come in. We help increase their salary. We help with their sustaining their businesses and really automate their system so they can spend more time doing what they love, which is working with kids. And so that's where we kind of drill in and support that work. And then again, we create the new family childcare from scratch. So there's a couple of different solutions for a really holistic approach. And that's where they get their websites and their marketing and their engagement with parents, much like Joel and Bennington.
Mr. Chairman and Representative Berger, there was a great example that I witnessed in Nevada when I went to visit. And there was I believe it's in the same realm of special ed that you were in, but it's the life skills, the very, and this teacher was getting burnt out, which I think I may not be overstepping by saying in your area of specialty, there's a lot of burnout. And so sometimes lack of support. And so this particular teacher that I found out about, she actually was quitting the district, going through the Wonder School program, and then she's turning around and taking and creating a childcare facility for herself where she can actually do more one-on-one with her students that she had before. So she had parents who would come, and so she had a special needs childcare. And so they were being supported and helping her so that she can achieve those goals. So that's another example of how the education part is really excelling, that you've got special needs people being able to go and have a better lifestyle, and the parents are loving it because they're getting that one-on-one care that they have. So that's another way that education is being benefited.
Very much. Appreciate it. Michelle, we're ready for you guys. Okay, introduce yourselves and proceed.
Thank you, Mr. Chairman and members of the committee. My name is Lachelle Brandt. I'm Senior Policy Advisor in Governor Gordon's office, and I really appreciate the time on a full agenda to talk about this important topic of early childhood, and I extend my gratitude for this being a priority on your interim topics. I will just start by saying governors across the country, Republicans and Democrats alike, are making early education policy a priority with recognition that this is a bipartisan topic and the years of early childhood education really do matter for children themselves, but also society at large. And governors on both sides of the political aisle are stepping up to championship early childhood education. You may recall at your last meeting, I testified and shared with you that when Governor Gordon took office in 2019, that he recognized how critical a strong start to a child's education journey is in helping them finish strong later in their education and future, and also how fragmented our early childhood system is at the state level. He seized the opportunity in 2019 to apply for the federal preschool development grant, Birth Through 5. And that grant was passed with bipartisan funding on supporting state systems building, and almost all states now have had 2 rounds of funding. I will also mention that the governor's the RIDE advisory group also made early childhood one of their main recommendations last year in their report. We're here today before you to share some of the work that has been completed through the preschool development grant and some of the work that is also underway on a variety of topics in early care and education, as well as share some policy recommendations for you to consider as a result of all of this work. Joined with me today is Jen Davis, Senior Policy Advisor for Health and Human Services in our office. Because early childhood programs straddle 3 agencies, we share this policy area, and Jen works closely with the Department of Family Services and the Department of Health. Elliot Regenstein is a partner at Foresight Law and Policy, and we have been fortunate through the resources of the grant to work closely with Elliot, who's a national published expert in early childhood. He's facilitated much of this work, and we thought today it would be really beneficial for you to hear from him, not only on the work that has occurred over the past few years, but some of his perspective working with a broad stakeholder group. And he's also here as a resource as you consider policy changes to our early education system. I will also point out in the audience, we have our Child Development Center directors, Tricia Wynot and Alicia Roan here as well, who have served in on the working groups and have been instrumental in also some of these recommendations. So with a lot to cover in a limited amount of time, I know we stand before you in lunch, so I will turn it over to Elliot to begin our presentation. Thank you, Mr. Chairman.
Thank you, Mr. Chairman, and thank you, Lachelle. It's been an honor to be a part of this work and to be here with the committee today. So, and I definitely am not running the PowerPoint, so thank you for doing that as well. I want to start by just giving you an overview of the topics we're going to cover, and we'll cover them quickly because there's a lot to talk about. We're going to talk about access to services, and there's a few different parts of that. One is, and that's on the next slide, one is about how the CDCs are funded to provide special education services. One is about how both CDCs and school districts go about procuring special education evaluation services. Another is to look at TANF and Title I and how school districts are using those to support positive early childhood experiences. And then also, I know there was a long discussion here yesterday about ESAs, and just wanted to touch briefly on how that fits into all this. We also are going to talk a little bit about some of the work that's been done to help support communities and families in navigating the different pieces of the system and sort of patching them together. And then want to end by talking a little bit about the efficiency of state oversight and some of the work that's been done to support that. So if it's okay, Mr. Chairman, I'd like to go through all of it because a lot of it's interrelated before diving into questions, and we're happy to answer questions about all of it. So on the next slide, it talks about a work group that we put together with the Child Development Centers, school districts, WDE, and the Department of Health to look at how early childhood special education is funded. And again, in the materials we sent, it includes a link to the full report. But one of the highlights of that was that we found that on a per child, per year basis, that the state is spending 51 cents for every 4-year-old compared to what it's spending on kindergartners. And obviously within the work group, there was a fair bit of concern about that. As you all know, in Wyoming, special education for preschoolers, there's a set number in statute and a once a year child count that determines sort of how the CDCs get funded. And the work group's recommendation was to change that to some kind of formula that can be responsive to the actual costs of providing the services and the number of children being served. The group did not develop that formula. That work sits ahead of us if there's interest in going that route. But that basically the group knew that every year there were exceptions being brought forward to address the shortfall and wanted to get off that merry-go-round, as it were. So that's one really critical recommendation that came out of some joint work. A second one that came out of a different work group is on the next slide. That talks about special education evaluation. And we had a work group looking at that issue, which was composed of different representatives from the CDCs and school districts, as well as the Department of Education and Department of Health. And one issue that really came up in that conversation was the fact that, and this I think is sort of a first cousin to the conversation you had this morning about staffing concerns in K-12, is that there are certain kinds of disabilities that don't come up that often. And so it's not cost effective for either CDCs or school districts to have full-time staff who are experts in that, but that when they need to do evaluations or provide services for children with those disabilities, it can then be hard for them to find the contractual help that they're looking for. And they may only need the equivalent of a tenth or a quarter of a full-time staffer, but that's hard to hire for, especially for some rural CDCs and districts. So one of the things that after the work group finished its work, we heard some examples from other states that have rural populations that have essentially taken a collaborative approach where there's a central entity, which does not have to be state government. It can be, but that's the group took no opinion on that. That is responsible for essentially finding the service providers needed, entering into a direct contract with them, and then subcontracting to both school districts and CDCs so that it's easier for those CDCs and school districts to find the services they need. This is something that over time should be self-sustaining, right? The CDCs and school districts have budget to hire those services on a year in, year out basis, but that one of the questions was there an opportunity potentially to get some seed money to get this, something like this launched and build the capacity to do it. So that was one of the recommendations that the group was looking at. And again, that both CDCs and school districts were really interested in that approach, as were the agencies involved. On the next slide, it's worth pausing to talk about the work of school districts on building preschool capacity using TANF and Title I dollars. I'm going to talk a little bit later about how we're going to know how much that's happening. But one of the conversations this morning between Senator Scott and Senator Rothfuss really spoke to why we're hearing this is going on. Because when you look at data on Wyoming school districts about student growth between 3rd grade and 12th grade, compared to national data, it's extraordinarily good, right? That school districts are doing an outstanding job of taking kids who are on track in 3rd grade and keeping them on track through the end of high school. What's really a struggle is kids who come in behind, getting them caught up. And so what a number of school districts have done is started investing resources in pre-kindergarten services and that are based on the state's learning standards and are meant to help kids get on track. So this is one piece of the early childhood puzzle. And again, early childhood is a mixed delivery system that looks a lot different than K-12. You have a lot of private providers, some of them very small, different kinds of settings. And so part of what we're now trying to do is get a handle on what exactly is going on out there. So that as the state thinks about its own role in supporting children and families in those years, it can have a better grip on what districts are already doing and how the state might want to build on that. On the next slide, it notes ESAs, which I know were discussed at length yesterday. I'm not going to go too deep into it because this is not something that we've had a work group discussing yet, but would only note that, it is the early childhood landscape, as I mentioned, is very different. And that the broader context of what's already happening in early childhood looks a lot different than K-12. So it's exciting that yesterday's conversation included discussion of how ESAs might fit into early childhood or might support early childhood. And as those conversations go forward, will just be important to take account of the larger early childhood context if the legislature chooses to move forward with ESAs, to structure something that actually can be supportive of both school districts and private providers in the early childhood space. One of the pieces of work that has been underway is alluded to on the next slide, which is trying to help communities build more intentional systems for school districts and private providers to work together. And that's something that a number of communities around the state have really been focused on, and that there are a number of school districts who have shown great leadership on that issue. But that because there are so many different early childhood options, and families navigate those differently, right? Like not every families may want different bits and pieces. They may have a kid who's in Head Start, but then also needs childcare for part of the time, who may be getting special ed services in some settings. So there's a need to think about how these pieces fit together and make it easier for families to navigate. As you may be aware, the state has an early childhood state advisory council that brings together leaders from different state agencies and from the field. Representative Brown is on it, among others, and that group has been working on developing a kindergarten transition toolkit for communities, education leaders, families, to help them make sense of all the different pieces. And it has both guidance for people who are coming to this new and examples from around the state of people who are already doing this work and doing it well. Hopefully that will be approved at tomorrow's State Advisory Council meeting, which will be in this building. And one of the questions that resources, in some other states, there have been efforts to support those communities in doing the work contemplated by the toolkit. Those would be grants to the communities themselves, and would likely not need to be very large, but that some amount of assistance for those communities might help them piece together their early childhood system and make it easier for families to manage. Another piece so those are some of the things that have been developed that are focused on supporting providers and supporting communities. There are a couple of pieces of work that speak to the state's oversight of the early childhood system. On the next slide, it talks about early childhood integrated data system. And it's important to emphasize that what this system does is takes data that is already housed at state agencies and integrates it to give a more holistic picture of what's going on statewide and in different communities. That is done with very strict privacy and security protections, and all of the data being produced from it will be aggregated data, so nothing will be individually identified, but it allows the state to take information it already has and use it more comprehensively than it could before. That structure has been set up, and that the agencies involved, DFS, the Department of Education and Department of Health, have all signed a governance agreement. DFS is the host for the system, and I am happy to say that the Department of Education has already put some data into the system. In the initial transfer of data, we learned some practical problems that we're now working on solving just to make it easier, but that we are very close to being able to integrate that data and provide an analysis that could look at both sort of childcare services and TANF pre-K services in the same community, which would be an exciting development. The Department of Health is planning to put data in. They've been doing some work on the underlying systems that hold their data, so they're waiting until that's completed to start putting data in. But we're very close to being able to tell a much richer story about what's happening in communities in early childhood in Wyoming. And that has been to date supported by a federal grant. There is some federal money to support it going forward, but that may not be enough to sustain it. So that's one of the things we wanted to flag as a conversation that may come to the legislature. The last slide talks about early childhood governance, which has also been a part of the PDG work. I know there are strong feelings on this committee from multiple different perspectives. I'm not going to change anybody's mind about any of that today. I just wanted to trace a little bit of history for the folks who haven't lived through it. As you may be aware, the Bipartisan Policy Center does a ranking of the efficiency of state oversight of early childhood and has ranked Wyoming 50th. In 2020, there was a task force that studied that issue and made a set of recommendations, one of which was to move the oversight of IDEA services into the Department of Education. In 2021, we did a transition report that discussed what that might look like. That was all presented to this committee in November of 2021. I'm not going to rehash it. But I would say it's, as you think about the broader set of possibilities for the early childhood system, to think about this as one of the pieces, given that a lot has changed since November 2021. It's a very different Department of Education. A lot has changed with the child development centers. I would certainly urge everyone on this committee to not take my word for it, but to speak to them, and to go back and read the original reports, which I think talk a lot about both why a change was wanted and what some of the very real concerns are with making a change, and that, you know, there are not a lot of easy answers in this space. So, but there are resources that can help guide your thinking, and a lot of folks who I think have some strong opinions, some of which you will undoubtedly hear in the next few minutes or from testimony later today. So again, we are not asking for anything specific or a bill or any specific action at this time, but we know that early childhood is important to the committee and wanted to give you an overview of some of the work that's already been done so that as you move forward, you can be informed by that and build on it. You know, again, these are recommendations and they don't have to get taken, but that they do represent a body of stakeholder work that hopefully will be useful to you going forward. And I will stop there. Thank you, Mr. Chairman, for the opportunity.
Mr. Chairman. Not a question, just a huge thanks publicly to Elliot. Elliot and I have been working on this PDG grant and I think one other task force for going on 2.5 years now. And his experience dealing with this with other states and his expertise in this has been phenomenal. And I would encourage the committee, I know he just breezed through 2.5 years worth of work in about 4 minutes, but the incredible vast knowledge that he has, I would encourage you to reach out to him if you have questions on this. He is a wealth of knowledge, and I just want to thank him very much publicly for all the work that he's put in for the state of Wyoming.
It's very kind. Thank you.
Okay. Thank you very much. Appreciate it. I didn't hear a specific ask for legislation at this point. I would suggest to you on the idea of centralizing some of the evaluators that are hard to find. Is it possible to organize a joint powers board that could be supervised by both the school districts and the CDCs and could obtain some of these people and make them available? Is that something to consider? I just ask you to think about that for the future. Okay.
Certainly, Mr. Chairman.
Anything else?
I'd just like to go back to the fact that you asked for a new formula for the CDC counting. I think we're probably the least best option to come up with a formula. So what's the plan?
Mr. Chairman, Representative Northrup, you know, I think there's a lot of interest in particular from the CDCs in working on that over potentially the coming year with maybe bringing some recommendations in the general session. We certainly are willing to support that as well from our office if we can be of assistance in providing experts who could really provide that information. It's probably needs to come from someone that has a very strong finance background and working with other states as well on these type of policies. Thank you.
Make a suggestion to you on that. That's basically a budget issue. And the argument is that it's simply the budget is not adequate. You're from the governor's office. The governor makes recommendations on the budget to us that we do pay attention to. So I suggest to you that's a good place to start.
Mr. Chairman, your point's well taken, and I think there are some recommendations for that within the budget.
And okay, good. We can also see that the child development centers are producing very good results and are a lot more efficient than the K-12 system. So if you have budget recommendations as to how to get the K-12 system more efficient, we'd be interested in those too, because we're spending a lot of money there.
I think on that statement, I would just be a little cautious. Although they are, I will say, efficient, we're in danger of losing our CDC here and many other CDCs across the state because of the lack of funding. They are taking on the highest needs kids, and we fund them at a fraction of the cost that we fund K-12. And I understand what you're saying. The other thing that I would say, keeping in line with the CDCs, I'm curious to know from the governor's office if there is a recommendation and if the governor is requesting us to potentially move parts B and C again to the Department of Ed. Is that a request, or is that something that we're just leaving alone? I believe we laughed up here. Senator Office and I shot glances across the dais here at each other because this has been something that we've been talking about for 7 years. It has been studied and restudied, and the recommendation always comes back the same. I'm just curious if that's something the governor and or his designees have an opinion on at this point.
Mr. Chairman, Representative Brown, I think you know our position from a few years ago. We certainly supported that move, and I believe, would still think that that is an important move for those programs. I think it's been studied, as you all know, a long time. And I think some of what was the pushback during that time has been addressed. And then, as Elliot suggested, I think there were concerns by the CDCs, and I think that the grant provided us an opportunity to really work through their concerns. And I do think we are at a place where funding was one of them, and we put that work group together. Special education evaluation was another one. So I think with those things in place, I do think it provides for better alignment and oversight of those programs. So I think we would still support the same recommendations. But again, it's all up to you as to how you, if there's an appetite to make that change. But we certainly found it to be, very difficult with it sitting in 4 agencies at the time. We've now dwindled it down to 3, but I would say it's still tough for families to navigate a fragmented system with services. So
Thank you for that answer. Mr. Chairman, as much as I would love to make the motion to draft that bill and resurrect it from the dead for the 6th or 7th time, I don't think we have the support for a 2/3 vote. And I don't want to put the work on staff nor anybody else to have to consider this. I do think it is something that this committee should absolutely entertain the thought of. And unless the governor brings that strong recommendation again, like he did a few years ago in the State of the State, I'm just not convinced that this committee has the power to bring a 2/3 vote to pass something like that.
A vigorous debate on that, and I would rather not because of time.
Yep.
I'd be happy to talk to anybody privately as to why. Okay, anything else? Anything else? Thank you very much. We appreciate it. Is there any public testimony on this issue? If so, come forward, the whole lot of you.
Mr. Chairman, Patrick Sweeney is online as well, so whenever you're ready to take that.
Okay, we'll take online last.
Good afternoon, Mr. Chairman, committee members. Dickie Shaner with the Department of Ed, and I'm joined up here by 2 of our CDC leaders. We have Alicia Rohn from Casper and Tricia Wynot from Cheyenne. And what we would like to do today is have those 2 explain to you some of the financial challenges they're facing at their centers and what they know about other centers across the state. And then I'll talk about 2 legislative items from the department related to that.
Hopefully you can hear me. Thank you, Mr. Chairman. I do want to touch on Representative Brown's comment, about the governance piece and how that has been a battle over the past few years. I know I've been well into it, let me tell you. I can tell you that, Superintendent Degenfelder, did make it a point to come and visit with the CDCs and let us know that her intent is to continue to make the CDCs viable. And I think that was lacking in our last superintendent, and lack of support for the CDCs. And I think we've turned a corner. I also think Superintendent Dagenfelder starting a cabinet for early childhood is a huge step in the right direction. And so I had mentioned in my last testimony at the last meeting that, you know, I do think governance and perhaps an early childhood office underneath a department is warranted. However, prior to doing that, we definitely need to look at the funding model of early intervention services for children as we are mandated to provide as a state. Just so you know, my CDC serves 445 children with special needs, ages birth to 5, just to give you an idea of my center alone. Currently in state statute 21-2-705 and 21-2-706, it states that the CDC shall receive $8,503 per child to provide early intervention services, along with $363 per child to provide social emotional developmental services, regardless of the increase in cost of living, regardless of inflation. That's the amount we get. Also, it states in state statute that our child count is December 1st every year. That means on that one day, however many kids we're serving, that's what we get funded for, regardless of the 47 children that we picked up last year after count. We only got the amount for the number of children we were serving on that one day. Additionally, the state statute states contractual payments to developmental preschool service providers shall be sufficient for the providers to provide adequate services for children aged birth through 5 years of age with developmental disabilities and delays, including compensation levels for early childhood special educators, occupational therapists, physical therapists, and speech language therapists that are competitive with local school district compensation levels for those categories. And I repeat, competitive with local school districts. I think we saw with Elliot's presentation that 51 cents on the dollar is definitely not competitive to local school districts. In fact, I lost 4 speech language pathologists to my school district this year. Why? Because they could give them $12,000 sign-on bonuses and a salary at a doctorate level. That has crippled my program. The $8,500 that we receive per child is in no way competitive with local school districts when that amount of money is supposed to cover buildings, transportation, salaries, wages, equipment, supplies, and in addition to that, we have to have general education in our programs for these kiddos, which we don't receive funding for. We must support an ECA, this legislation, for CDCs, as we are $10 million behind in funding. The next year, we will be working on a new early intervention funding model to bring to the table that will replace our archaic per child amount that's in state statute. If we don't fund early intervention as it states in our state statutes, and as we are mandated to as a state to provide, I'm afraid we're going to see CDC shut down across the state. We're already seeing them affected. With my colleague here in Cheyenne, Jackson, and other smaller CDCs are going to shut down. And then what are we going to do for early childhood intervention? So while I agree that governance is still a component of this, funding has got to be the priority to keep the CDCs viable. And I'll turn it over to my colleague.
Thank you. Mr. Chair, committee members, thank you for giving us the opportunity to steal a few moments of your time. I know you must still be very tired from yesterday. That was a long day for you all. So hopefully this will be a positive afternoon, a good way to end your session. I'm here. My name is Tricia Wynot, and I am the Executive Director of Stride. I've been at Stride Learning Center for 30 years, so I've seen a lot of growth and change. I've seen a lot of growth and change with our laws and always improving what our children need. I'm here talking today about special education. It's not a welfare program. It's not a charity. It's special education, and our Wyoming Constitution says we will educate all of our kids. So that's why we're here. And thank you for your time. I'm fortunate to sit on the Early Childhood State Advisory Council, and I too have been able to work with Elliot and Representative Brown and some really neat leaders, and a lot of legwork has been provided to get where we're at. Ms. Rowan is absolutely right. All the CDCs are now coming together to put together, and we do need expertise from the governor's office and others of someone who can build us a formula to replace the per child amount. And I'm happy to say that Stride Learning Center is part of CDS Wyoming now, and we're invested. All of our cards are on the table, and we are going to all work together to push forward our systems so that we stay viable. As for Stride Region 12, we serve all of Laramie County. Currently, we have over 530 children from birth to kindergarten, and we are struggling. And I told you all in May, and things aren't any better for us here. We had 2 buildings, one office, our infant and toddler team. We just recently sold that property. We needed that money to invest and try to grow a little bit of earnings from that. We also know that money from the sale of that building will be used in our 4-year program, 4-year strategic plan to continue to do the important and good quality work that we do for children and families. Again, after 4 years, we will have depleted all of our reserves. And so we're optimistic. My board of directors is optimistic. The staff that remain are very optimistic. Our families are panicked. They're nervous. They're scared. I too have lost a lot of staff to our local school district and other avenues. We ended up also, even though we lost some, I did have to lay off 15 people as well due to our budget cuts. That hasn't changed the number of children and families we're serving. It's still 530, and that grows. There's never a waiting list. No child is ever turned away. It just makes caseloads extremely large, and for long, busy days, much like you all had yesterday. So my message is we will come back next year with a formula. We hope that this good committee would be willing to consider drafting some changes in legislation with our funding model. And maybe one day down the road, we'll talk about governance again. But I'm in agreement right now. It's about a need to change the financial structure of our per child amount. And I'll stand for questions.
Thank you, Mr. Chairman. To reiterate 2 points from the state superintendent that have been mentioned several times. Time is of the essence with funding for CDCs, really and truly. And the first order of business is the ECA that will come through the Department of Health's budget. They'll work through the governor's office and get that presented to you all in November. Whatever that number is at, it's very much needed. And that is sort of the immediate funding item that will come before you for the CDCs. And then that second piece that's been discussed, the funding model, the CDC Association is they're pooling their resources to look at hiring an expert in creating early childhood funding models that we will be able to provide to you, perhaps JAC, any other legislative members next interim to really work on trying to get a substantial overhaul of the funding for the CDCs in the 2025 session. So ECA 2024, new funding model 2025. Thank you, Mr. Chair.
let me ask one question. We've got here in the statutes a formula that specifies specific dollar amounts with no provision for dealing with inflation. It has worked sort of since, I think it was put in 15 years ago, thereabouts. While there was very little inflation in society, it worked. But it's a classic recipe for disaster when you've had inflation, and we all know there's been significant inflation. My question to you is, would it be useful for this committee to sponsor a very simple bill this session that would remove those specific dollar amounts and require that those dollar amounts be set in the budget bill every year, every 2 years, so that there would be a specific license for the Appropriations Committee to match the formula to the funding that they see that you all persuaded them is needed. And that would get rid of the specific dollar amount. Would that be a useful thing to do? And I asked the committee to think about that. I'm asking you all to think about that right now and tell us, is that a good idea?
Mr. Chairman, I'll go first, if you don't mind.
Okay.
When times are good, that number will be sufficient, and when the coffers are on their decrease, that there will be cuts that will be accordingly, and that could be disastrous to the CDCs to end up with a lesser amount. They'll be cutting staff. And
That's probably built into any budget in the state.
yep, they're getting a certain set amount right now, and that's guarantees them a foundation. They know where they're going to be, and I think that's what they're used to working from. So that's my 2 cents.
Mr. Chairman.
Oh, sorry.
Mr. Chairman, I would tend to wholeheartedly agree. And my first thought was it also puts the poor CDCs in a position where they have to come back and fight. At least right now, they're guaranteed 8,500. They could be fighting for 5,000 if times are like they were in 2020 and 2021. I appreciate the thought process. My original thought was to just say, okay, let's draft a bill for this consideration for this session to say, let's up it to 10.5 or 11,000 for right now and just get them something to boost this. And then we'll have, next interim, as Mr. Shaner was saying, to really come in and look at an actual model. But it's abundantly clear when we've got 2 CDCs and one is the largest county in the state and the other one the most profitable in the state. And they're looking at shutting down in 4 years. Well, one's looking at shutting down in a year and the other one is looking at 4 years. We've got to do something. So just my 2 cents.
We had a few years ago with the adult DD providers, where the health department budget was going to bankrupt a number of them. And we had to do something, and it's a budget fight. And what I'm saying is, what is there, with this in the statute, is there an adequate mechanism for the executive branch to propose a budget change that will deal with the problem this time, or do we need to do something drastic right now?
Thank you, Chairman Scott. I honestly think that pushing the Department of Health is going to put forth a large ECA that will help us. And you did approve a $4 million ECA, which was $2 million per year the last legislative session, which we truly appreciate. But again, we're now over $10 million behind because every year we were proposing an ECA and every year the Joint Appropriations Committee didn't approve it. And so that's why we're now at the point that we're at, along with that amount in state statute. And so I guess for me, and correct me if I'm wrong, Tricia, I think getting you all on board and approving that external cost adjustment that the Department of Health is going to put forth will help us in the interim of creating a new formula that will also include, obviously, an increase to the per child amount and not just a one count date. The school districts do the attendance reimbursement. Yeah. And we used to have a 2-year count date, one in the fall and one in the spring, and we averaged those out. We're even taking a 3-year average because sometimes our count is down, like in 2020, and then it's up the next year. And so we're on this constant roller coaster of staffing, providing for the needs of kiddos when we do have an increase. And so I just feel that supporting that external cost adjustment and getting your fellow legislators to support that external cost adjustment would be the best route to go in this budget session. And then let us come back to you with an ideal formula.
Thank you, Mr. Chairman. I tend to agree with you in terms of your approach, but could you give us some kind of idea what that ECA was going to look like number-wise?
Well, I did ask Director Johansson what that ECA would be, and he does not feel comfortable releasing that amount yet because he hasn't submitted the budget. But, last year we went in with a request of $11 million, and it got broken down to $4 million, which in turn was $2 million a year. So obviously it wasn't sufficient. I'm hoping this year it will come in much higher.
Thank you.
Let me say at this point, the agencies are reluctant to be specific on what their budget request is because they do not want to upstage the governor. And that makes a good deal of sense. So
Yes, I got the ballpark figure I was looking for.
Okay.
Thank you.
Yes. Yep. Thank you all. Okay.
Just a quick question. It's not so much what are we looking at an ECA, but right now we have 8,500, right? And that's kind of what we've set. What's the magic number that you guys see on a day-to-day basis that would float, right? What is it that you guys look at? And what is that would put the money back into your guys' pocket and allow you to stay in business?
Mr. Chair, committee members, that is the golden question right there. And I do believe the good work that Elliot and the committee and councils have done will help drive a good determination. What Stride would need would be different than some of the other CDCs. My short answer is one that often legislators don't like hearing. But we have the same state licensed physical therapists, speech language pathologists, licensed teachers of the visually impaired, teachers of the deaf. The long and the short of it is we have the same IDEA FAPE, free and appropriate public education that we provide to our 3, 4, and 5-year-olds that the school district provides to their 5, 6, and 7-year-olds on up. So the short answer is we need what school districts need in order to provide general education, specialized instruction, all the related services, transportation, buildings, custodians, accountants. And so we lack that infrastructure. We can do without that because we do. We have fundraisers and we do nonprofits and we scrape and we scrimp. But if we're really going to get down to it and we want to solve this for the future, for all the children 3 through age 21 who are entitled to special education, then you're really looking at something that is comparable to what a local school district would be receiving. Thank you.
Of y'all, these figures here, the 503 and the, that's in the statute, and the 363 that's a few lines further down, can you, either you guys or the department, find out that was enacted in a specific year, identify that year, and tell us if we had escalated that by some of the various inflation adjustment measures, what would those numbers be today? That would give us ammunition for, frankly, for the debate on the floor. That says, look, legislature decided that number was adequate when this was enacted. How much has inflation changed that same number as we go forward? And that, I think, would be persuasive. So could you all collectively figure out that one and furnish it to us?
Yes, and we can do that, definitely. Mr. Chairman, we'll work on that. And the other thing we wanted to make note of is, you know, the 8,500 or 8,800, that's for special education. We as CDCs have to provide general education and preschoolers that are pace setters as well, so that these kids are in a least restrictive environment. So let's say your kiddo is on an IEP and you want to keep them in a private preschool. You don't want them to come to the CDC. We have to pay for a portion of that child's tuition at that private preschool to ensure that they are getting FAPE. Even though I have spots open at the CDC, I'm paying for their private preschool tuition. You can imagine the cost of that in Jackson and even Casper. It's unreal, and we don't get any funding for that. Federal.
And committee, you need to understand, on a federal mandate, that's something the feds don't fund. They tell us that they're implementing the Equal Protection Clause of the 14th Amendment, and we got to do it. And so that the instinct is to, well, let's change that, but we can't. Okay.
Mr. Chair.
Matt.
Mr. Chairman, just a couple items of consideration. One is the Department of Health by law, by statute, is required to provide a recommendation to the legislature related to the external cost adjustment provided to K-12 education that's assessed on its per pupil amount in statute. And during the 2023 supplemental budget request, they do that on a cumulative basis, and the per pupil amount that would have been, or that was calculated based upon their analysis required by statute, was $11,219.45. So that was what was requested last year in accordance with the law. I think that addresses your question, or the ask of the presenters here.
Mr. Chair, I do have some information about that 363. It was back in the days when Mike Massey was around and doing his good work in our Wyoming legislature. He also was the executive director of the child development group system that we have together. That was specific for social emotional curricula and training, and that has carried on. The centers use a variety of different curriculum. Our center, for example, uses something called Second Step, but that was specific to address a need that was maybe not being addressed as rigorously as we had hoped back in early 2000, and it was before 2006. So that's why it's in there, and it's a funny little line because it is for social emotional development and growth for our preschoolers. It also requires an MOU or some sort of agreement with local counselors and psychologists to provide some of that mental health help that we do know starts way down in preschool. And so that's where that came from. It is a funny little amount, but it was specific for that. And that goes back to when Senator Beitman yesterday was asking about the whole child and social emotional. When did all that happen? It's been 20 years plus since we've really looked at the whole child. Thank goodness we do. Physical, mental, cognitively, the whole aspect. And that's where that money came from. Thank you.
Thank you, Mr. Chairman. One of the privileges of being a citizen-led legislature is that when we're not here, I get to be out and I get to be a mom, I get to be a nurse, I get to interact with the healthcare community, I get to take my kids to their appointments and such. I have a child who did gain some good services from our local CDC. And I want to just kind of speak to specifically Laramie County, though, because being out in the community since our last education community, I took my son to an appointment. I was simply sitting in the waiting room at an appointment and heard some therapists talking, and it was very disturbing what I heard, very scathing about how they felt like things had been maybe mismanaged locally with our CDC. These were people who are quite qualified to do that. And so I'm not saying that we don't maybe need more funding, but when I sit in here and hear that I have more funding, but the perception of our community is that our funds are being mismanaged, that things are not being run well at the current CDC, how do I go back into my constituents and answer them when the community perception is just that?
Mr. Chair, Senator Brennan, that's very disheartening to hear, and I would love to have a private conversation with you at some point. As far as mismanagement of funds, that has not been the case. Stride Learning Center Region 12 has always had a clean audit. McGee, Hearn, and Pies does 2 different audits on our program every year. One is operational, and one is for our retirement 401k for our employees. And it has not been for lack of management. Our school board, my volunteer school board, which is what it is, board of directors, take their fiduciary responsibilities extremely serious. And we have had really good, strong citizen board members over the last 3 decades. And currently we have an outstanding board. We have a wonderful treasurer, and we have a very keen eye on all of the finances. What might happen is we had a shift in thinking about 6 years ago. And what happened about 6 years ago is we got really serious at Stride Learning Center to provide an entire FAPE package, which includes a very full and comprehensive evaluation that also has to adhere to the state Chapter 8 standards, the same criteria that our school districts and WDE require. It's the same threshold, a very high level threshold. And you must determine educational need. There were some disgruntled therapists that thought we were not qualifying enough children that maybe had a speech articulation error and maybe did not have an educational need. They needed therapy in a clinical setting with a private practitioner. They did not need to be labeled as a special ed student. We took a hard line, and that upset some therapists. Some therapists left because they thought we should qualify all kids regardless, because they didn't want parents to have to pay out of pocket. So I hope to goodness that's what you're alluding to. And I would love to talk about it at some time. But as far as management, 100% I can say it's been managed well. Thank you.
Thank you, Mr. Chairman. Thank you for being here and the work that you guys do. Physical therapist, during my normal job. So with your funding that you've been on for the last 15 years, do you provide services 9 months a year like the school districts, or are you guys open year long?
So we're open year round, and we provide summer school services as well as and infant services.
Extended school year services, ESY, for children that need that extra time between a traditional school year in order for their IEP to be fully maintained. And the infant and toddler program's 12 months. Plus, there's also transition evaluations for children that are going to approach their 3rd birthday. That happens every week, year round.
This year. Sorry, this year, my center, we sent about 175 on to kindergarten. So it's having those kindergarten transition meetings and prepping them and the families for kindergarten. But let me say that the CDCs have been in existence for 50 plus years. And so, yeah, we're going to have some complaints, but if you look at the thousands of families that we have impacted, we could fill this room and send you thousands of postcards like the teachers did. And I just want to state that. You may hear some negative, but out of the whole, we've done a lot in the past 50 years to serve families.
Chairman Ruff.
Thank you, sir. We could, as a committee, pen a letter of support to JAC for the additional funding, and that we'd have some kind of support for that. So how's the committee feel?
Your co-chairman thinks that's a good idea, that perhaps the next meeting is time to do it, but that would certainly put us on record, and I think we need to talk about it, but I think there should be support for that.
Mr. Chairman, I would just say I think it's a good idea, and it'd be helpful maybe not to take that vote this time around, but also to hear the information at our next ECA for the school districts and what we're planning on hearing here in just a couple of months on that as well, because I think that will give us a little bit broader understanding of exactly what we're talking about as well. So I think it may be a little premature at this point to pen that letter, but I think it should definitely be on our agenda for the next time around. You bet.
Thank you, Mr. Chairman. And I don't know if, we want to put a temporary solution for these folks, looking at when these numbers were put into statute. With the cost adjustment, we're looking at, that $8,500 is now $12,290, and that $363 is now $525. So if the committee would, if at the will of the committee, I'd like to maybe have that change drafted for the next meeting, and we can consider if we want to adjust that for now until we can have the broader solution.
That's basically a version of the suggestion that I made earlier, but with a specific number in it. It sounds to me like the executive branch is pursuing a pure ECA solution to this temporarily, and then talking about redoing the funding formula. And I think we're probably better advised to support that rather than to bring a bill, because the risks of a bill in a budget session are such it might well fall by the wayside and be an excuse not to do anything. So, you and I were thinking on the same or similar lines, but I think the advice we've gotten is not to do that, and I think it's probably sound advice. Okay. Anything else? Thank you very much.
Thank you.
Is there anybody else, public comment on this issue? Anybody else? Seeing none, thank you
Mr.
very.
Chairman, you do still have Mr. Sweeney online.
Oh, okay. Put him on. We'll give him a couple minutes.
Okay.
Thank you, Mr. Chairman. Pat Sweeney from Casper, representing myself. I appreciate the conversation. I do believe your initial thought process, Chairman Scott. I might urge you to rethink about moving some sort of dual approach through legislation with the increment that Representative Provenza just mentioned, also supporting the ECA in dual fold. I realize it's a budget session. Things are going to be tough to get through to begin with on these issues, but the other thing you might consider is there a way temporarily on the count that could be adjusted during this session? That's also a budgetary concern, as it sounds that you just heard. So lastly, on the governance piece, as you're moving forward with the recommendations next year through the working group, I don't think it's fair that the CDCs are tasked with chipping in on the consulting and next piece. Can't the Department of Health or the Department of Education find some monies rather than expecting the CDCs to come up with those additional funds when the state's not willing to fully fund their ECAs in the past? And on the governance piece, I believe all of these issues are fundamental to long-term funding, which you're going to have to deal with one way or another. They've made a very strong case that you've heard from them. Our center just losing 4 speech pathologists to our district. And so in that part, funding, and the resources necessary to make it all happen. And I think that was my concern in not supporting a couple of years ago, as Representative Brown mentioned, the pushback from some of the current committee members and legislators in the past, like myself, didn't think we were ready. But we've gained a lot of ground, very short time with our new superintendent, Dagenfelder, on this precise issue. So thank you for your time and enjoy the lunch.
Okay.
Mr. Chairman, on the idea of having a bill draft available, it's probably a 2-page bill, and it has a ball in our court at that point if we wanted to have a little bill draft that had the $12,000 and $5,000 numbers for us to consider. It would be on the table next time, and it'd be an announcement. We've done that certainly on the School Facilities Committee a lot of times, where we've just put bills forward and then sent a letter to the Appropriations Committee with our recommendations, but we don't regrettably get to control the Appropriations Committee despite our attempts. And it's often better to have some alternative vehicle which is in our control, where a committee-sponsored piece of legislation would be in our control. It'd be my inclination for us to have that two-page bill in November available. And I'll make that as a motion if you want, but I just wanted to chat about it. I'll move that we have a bill drafted to increase those fees in statute, or not fees, payments in statute, to inflation-adjusted numbers, preliminarily $12,290 and $525 respectively. That's my motion.
Certainly in order. I think I'm going to vote no, because it's along the lines I was thinking of, and frankly, the CDC directors and the State Department of Education convinced me they had a strategy that I think was better, and I'm a little afraid of prejudicing. If we draft a bill and then don't move it forward and can't get it introduced or can't get it passed, I'm afraid it would be used as an excuse to do nothing or do too little. And that worries me. We got an emergency on our hands, I think.
So, Mr. Chairman, I don't know that we even have to move the bill next time if we have good confidence and if we've seen the budget request and we understand what those numbers are. At this point, we have speculation that the governor probably will put forward a budget request through the Department of Health that may be sufficient.
Trouble is that our next meeting will be before the governor puts out his budget recommendations.
Yeah, and Mr. Chairman, even then, it's certainly not unheard of to have a bill that passes out of the committee with the discussion that we're going to bury the bill up until it's needed. Certainly done that before on this committee before. In fact, we've done it on the School Facilities Committee just about every year, where we pass our own budget and then we make that recommendation to JAC, and then we bury the bill because JAC picks up the recommendation, puts it in the budget, and we never see it on the floor. We do that so that we have it available because, again, it's what's in our control. And if the JAC ends up moving it forward, we have that flexibility. It's the Hank Coe, let's ride two horses approach to legislating.
I would just say I fully support the idea on this, and I actually, my gut reaction was very similar to yours. I feel like it maybe almost taints the water and potentially gives us a little bit of a scarier side of things. I don't feel like there's any problem with us having the bill drafted to at least look at and have the discussion over next time around. If we decide to not carry it forward, cool. Just vote not to do it. But I think it's a good idea for us to at least have a couple pieces of paper in front of us to look at and get a better understanding of what it's going to look like.
Mr. Chairman, will a bill only be 2 pages? What if it's 3?
Might be 3.
It might be 1.
Yeah.
Simple, simply updates those figures. And
Mr. Chairman, regardless of the governor's budget request, the Department of Health is required to adjust that within their budget request on an annual basis. And so I think what Senator Office's motion is how I'm interpreting it, is to work with the Department of Health prior to the November meeting to have them adjust those amounts up to the ECA levels based upon the current law. And if I'm wrong,
want to do it
please
that
correct me.
way? Or do we want to say, let's adjust those for inflation and not depend on whatever the Department of Health might come up with? Say this is what would be if we simply adjusted for inflation.
So, Mr. Chairman, the numbers that I just provided were based on Representative Provenza just taking the CLI from when it was written. But the ECA is a more appropriate and sensitive calculation. So it's probably a better answer to go with what Mr. Wilmarth is saying, which is what the Department of Health is going to calculate So about the same number probably, but I think that's the correct number, so to speak. So I would defer to Mr. Wilmarth in working with the Department of Health. As he said, it was like 11.8 or something like that for last year. It'll be changed again based on inflation. So it'll be comparable to what we discussed.
Okay. Heard the motion? All those in favor say aye.
Aye.
Opposed? That carried. Okay. It's almost 1 o'clock now. Be back at 2. No, that we want to be well out of town by then. Be back at 2. We'll finish up on the reading assessment and finish the agenda. We've got a brief thing on recalibration, and we've got community colleges. And community colleges, essentially what we want to do is have you take us through the written material briefly so we can ask questions about it. Okay?
We're recessed.
We're recessed. May I suggest to people that we really want to get started promptly, and I think probably fast food, these